have a timer.
I wondered if that's the way we
It's gonna take a second.
But good.
Yeah, that one's turned off. Basic size. Ever accurate.
Yeah, which is good because that's how I get to accurate.
Yep.
But okay, if you charge,
Oh yeah, they're all
good, thank you. see what you're saying. Okay. Yikes. Good morning. Good morning. Welcome to day 2. Maybe I should pull it out. Okay. I will pull it out. Good morning. Welcome to day 2 of our Fox Reading Conference. Thank you for joining us again today. Let's just start out today by giving a thank you to all of our presenters from yesterday. If you weren't here yesterday, we had a really great day. Sorry you missed it. If you were here yesterday, thank you for coming back. Our presenters were fabulous. I have a couple of housekeeping things, the biggest one being the attendance. So everybody just take a moment here. Thank you for working with us. So I have figured out, I think, what the problem was. If you are registered, virtual or in person, I promise you we sent you an email with the link to the attendance verification. We are realizing that Gmail and Yahoo were perceiving it as spam because so many people registered. So when it went out through our system, through RedCap, they were just denying it. And so you never got it. So it went out, but you didn't receive it. So Gmail, Yahoo, and then several school districts were also doing that. So I came up with a plan B, which is going to be a Google form. So if you did receive the email with the attendance verification link, you can cover your ears. You're going to do it that way. You received the email. That's great. It worked for you. That's the way we're going to do it again today. If you've already put in your codes, fabulous. Don't listen to this part. If you didn't get the email, I have sent out a link to a Google form, and Jen's back there at the table sending them out today. We've sent it. That didn't work for about 200 to 300 people. So if you did not get the email, you're doing the right thing. You're emailing me. I'm sending you the link to that Google form. You're only going to fill out that Google form one time, and it'll be at the end of today. You'll put in your codes for yesterday and today. All right? So if you got the email yesterday, golden, you'll get another one today. No problem. If you did not get the email yesterday, just email me, and I will send you a link to the Google form. Okay? We're going to work this out. If you are registered and you are here, you will get credit, I promise. I promise. Okay. So that's the housekeeping. So we would like to start out today by acknowledging our platinum sponsor, Lipscomb University. They are here. They have a booth out in the pre-function area next to Hoover Learning Group. And don't have my glasses on. And to tell you a little bit about Lipscomb, Lipscomb's College of Education provides high-quality relationship-based teacher preparation that equips educators with the knowledge, skills, and support needed to be successful in the classroom. Beginning in the summer of 2026, they will expand this work through a new partnership with Hoover Academy to launch a dyslexia therapy program grounded in structured literacy. So please be sure to stop by Lipscomb University and Hoover Learning Group's tables. Would also like to acknowledge our gold sponsors, Redstone Federal Credit Union, WordFlight, the Tennessee branch of the Academic Language Therapy Association, or ALTA, Amplify, and PCG. Please visit their tables and all of our other fabulous sponsors. Okay, so I am going to reintroduce Dr. Jan Hasbrook, who's going to open up day 2 today with a keynote on delivering data-informed instruction. You can see Dr. Hasbrook's description of her opening keynote on page 26. I'm not going to go through the whole introduction yesterday that I did because she was here, and you could also read about her if you missed it yesterday. But we are starting just a little bit early, so if Dr. Hasbrook ends before the time, then we just have a little bit of extra time for our break, which I don't think anyone's going to hate. But I will ask you that if you are in the group of people that received the email, if you could just make sure to put in those codes by the break. I'm going to go ahead and close that form at lunchtime today so I can open up this form for today, okay? So if you got the email, go ahead and do that before lunchtime. Were you raising your hand? What's that? It's already closed. Okay. So you did it as soon as you opened it. If it's just email me, and I'll send you the Google form. It might just be, honestly, I might just send out the Google form to everybody at this point, because I don't know, RedCap is not my friend today. So we might just all use a Google form, and then you put in everything all at once. Okay. Any other questions? Great. Okay. Without further ado, let me reintroduce Dr. Jan Hasbrook.
welcome. Well, welcome back, everyone. Let's see if we can get my slides up on there we go. I've asked much of the tech people today, so one last thing. There we go. So yes, as promised yesterday, we're starting the day with a discussion of data. Yes, that's how everybody wants to spend their Friday morning. We need to. It's important. So let's go ahead and do this. I am today in this session really presenting as one of the chapter authors. So this is representing chapter 4 in the Climbing the Ladder of Reading and Writing book, the chapter that I wrote about using data to inform our decision. So we have to get this right. What we know about schools, you all know this. This is going to be just simply affirming what you already know about schools. I remember reading a book by Roger Croth and his colleague back in the early 2000s. They've, I'm sure, done a lot of work, but they wrote a book specifically about consulting with families and parents. And I was at the University of Oregon at that time. We had received a grant to train people to be parent home consultants. So we were eager to read his book and use that in the course. And I remember opening the book, and I think it was in the preface to the book, that these authors made this statement, that it is axiomatic in schools. They didn't specify which schools. In schools, everywhere, it doesn't matter. It's just a accepted fact that there is never enough time. You agree? Yeah. I often preface this by saying, get ready, I'm about to say a 4-letter word. I think time is the 4-letter word of education. I mean, there simply isn't enough time, no matter what we do. There's not enough money. And you could probably guess what the third one is. There aren't enough of you. People who give up their precious time to sit in a conference, to learn more, continually learn, to improve their training, to hold themselves, as you do, I know, to a high level, high standard professional. There's just not enough time, there's not enough money, there's not enough trained people. There isn't now, there never was, and there never will be. And I remember reading that and saying, whoa, why are you starting your book like this? Because it sounds kind of negative, defeatist. We can't do it because there's not enough time, not enough money, or not enough people. But then, of course, he went on to say, let's just get that out of the way. There isn't enough time, there's not enough money, there's not enough people to do the incredibly difficult and important work that we do. So we have to treat these things as challenges, not obstacles. Those people out in the field or in our profession who say, we can't do that because we don't have enough time. We can't do that because we don't have enough money. Oh, that would be lovely to do, but we just don't have enough people. Those are people who are using axiomatic facts about our profession as obstacles. You have to say, yeah, we don't have enough time, we don't have money, we don't have enough people. Let's take a deep breath and figure out how to do this important work anyway. So I acknowledge that. I want to start with that because it's really relevant to data collection, very, very relevant to data collection. My current guru of assessment, if I had a team of them, it would certainly include Matt Burns at the University of Florida. He says things very straightforward way. He understands data really, really well and explains it well. He made this statement, posted it on social media. If the data we collect doesn't improve the life of a child, then why are we collecting it? Boom, yes, of course. Jonathan Cohen, who I don't know, but I like this statement. Educators are now used to data being used as a hammer rather than a flashlight. I agree with both of these statements very strongly. And they are kind of incorporated in my personal philosophy. This is not listed as my philosophy, but I want to own it. This is mine. I made this up. This is my thinking, and I want you to know it before you listen to me talk about data. But this is the conclusion I've made after all these decades of working in school. Most schools are doing too much assessment. An opinion, it's my opinion, and not all schools are. But I visit and work with a lot of schools around the world now. I'm blessed to be able to do that. And I would say in most cases, very different than when I first started teaching, where we rarely assess kids. We who were reading specialists might do some diagnostic assessments, but the system didn't have assessments. We might think about that as the good old days. But there were problems with that when we didn't assess kids. The state where I worked originally, Oregon, required all fourth graders to take an achievement test. So that's where we tested kids. Of course, we didn't get the results. Remember, that was not in the computer days. So we didn't get the results back to the first few weeks of fifth grade for these kids. And we sat around the table and looked at the results and like, oops, saying oops in the first few weeks of fifth grade is a little late to identify children. But we flipped, as we often do. We ride this pendulum in education, and we are now perhaps, in some cases, in my observations, in most cases, collecting too much data. Number two, though, we have to conduct assessments. We have to use that data to inform our work. So we have to find the middle ground, the right amount, because we must collect useful data, but we must do it as quickly and efficiently as possible. Carlin talked about that yesterday. I kept hearing her say, and I think Kathleen too, Catherine, efficient, because it's not the data collection that's important. Remember, we don't have enough time, we don't have enough money, we don't have enough people, and what we need to do is instruction. The most powerful, effective instruction, and we don't have enough time for that, so we take time away from assessment. Yes, we do, we have to, but let's do it quickly, efficiently, and collect useful information. And number four, if we are in fact going to spend time, our resources, time and money and people power, to collect data, then we should use the results. This is also a problem I see in a lot of schools. Lots and lots of effort, lots of time, money, and people power expended to collect data that they don't use. They create, they fill out forms or something, but at the end, it's like, okay, now finally we're done with all that testing. Now let's try to figure out what to do in the classroom. So if we're going to do that, we need to use it. Many years ago, as I was starting to think about the role of assessment in my work as a professional and how to discuss this and share this with my professional colleagues like you, I came up with this analogy. In my head, it seemed like what we were at least attempting to do in education very closely mirrored in many ways the work of physicians. We are both, in ways, saving lives. I mentioned yesterday Steve Dykstra. At least one person here in the room said that she knew Steve Dykstra as well, that psychologist who works with traumatized youth and adolescents. Every time I hear Steve speak to a conference of educators, he always says somewhere in his talk, you need to understand that you are saving lives. You are saving lives through your teaching. And that teaching is something nobody else can do. We clinical psychologists can't do that. It's the teaching, it's the changing those children's brains, it's making them literate that can, in some cases, save lives. So there's a parallel. Physicians go around making us healthy and strong and well, and in some cases they save lives. They use data-informed decisions. At least I hope they do. I don't know about you, but I would not go back a second time to a physician if I went in to have an examination or to talk to them about a physical challenge I was having, and they said, well, you look fine. I think you're good. Why don't you come back? Or based on what you just told me, I think you should take this medicine. or have this surgery. Could you maybe, I trust your judgment. That's great that you've made this conclusion, and I hope whatever you're prescribing me makes me feel better. But I would be slightly more comfortable if you collected a little bit of data. Listen to my heart, maybe, look in my eyeball or whatever it is that you do. But before you prescribe medicine or send me to surgery, I think maybe a little bit more data would make me feel comfortable. So we want those decisions, our decisions and the decisions of our colleagues in the medical world, to be informed by data. We're here to talk about Nancy's ladder, and data-informed decision is part of her ladder. It is part of that purple arrow where all children deserve differentiated instruction. Differentiated instruction needs to be systematically designed. I'm going to be talking more about that at the end of the day. And it needs to be data-informed. All students deserve data-informed instruction. Because we talked about this yesterday, our children, you didn't need to be told this. This is not new news. If you've got more than one child in front of you, you need to do some differentiation. It's very likely. I, for a few years, have used this graphic as a representation of the importance of differentiation. I borrowed this after seeing some of my, I attended a school psychology conference, NASP, National Association of School Psychologists, and one of the presenters used this as a reminder about the need for differentiation. Now, this is, of course, representing the typical classroom of 10 children. Yeah, that's a laugh line. You're supposed to laugh at that, yeah. No, although some specialists may occasionally have groups of 10, but this 10 is meant to represent, you would double it for a 20 people classroom, 30 people classroom. Susan Smart, who was here yesterday, told me that her first teaching job was a classroom, 5th grade, with 43 students in it. First year, she said, I had no idea what to do. So you can take these 10 children, and I think it is that they are fairly representative, and you could double it or triple it or quadruple it or whatever, and it would be fairly accurate. You've got, and what these numbers underneath, these are not IQ scores or Dibble scores or whatever. These are hypothesized from what we know about learning and educational psychology. These are the number of repetitions, exposures, that each of these students is going to need in order to learn whatever it is you're teaching. You're teaching a math fact. You're teaching a blend. You're teaching how to outline. Whatever it is, these children all, I hope you're hearing this message, all these children, no matter who they are, have the capacity to learn whatever you're teaching, limited by language, as we're going to talk about a little bit, but they all have the potential. Some of them, though, they're all different in terms of one aspect of teaching, which is how many exposures or repetitions are they going to need. So do you see in this group the child with the 0? I told the story yesterday of Nathan, a little kindergartner that I had the pleasure of, ultimately it was a pleasure. He was a little annoying at the beginning, but he was a kindergartner, and I was doing beginning reading assessment, and he kept telling me that he could read, and lo and behold, he could read quite skillfully at perhaps about the 3rd grade level, 4th grade level as a kindergartner. I'm not sure he could understand all that, but he could read. He did not need to learn a blend or how to sound out, this CVC word. So he's the 0 in the class. There are going to be children in your class, students in your classroom, who already know what you're about to teach. Maybe in a reading lesson, these are the kids in the dark green. They already know it. What is our moral, ethical, instructional responsibility for these children? Should they just sit there? It's not going to hurt them. There is some evidence that researchers have documented that these precocious, skillful, advanced learners are damaged to an extent by sitting through the instruction that's not appropriate for them. So we have to acknowledge that child. Many of these children sitting in this classroom have the typical number of expected repetitions, 4, 3, 9, 7, all in that range. That would be those children who would benefit and potentially thrive from what we're now calling Tier 1 instruction. The regular curriculum, the grade level curriculum, presented reasonably well by the teacher in the normal, typical amount of repetitions, they're going to get it. And then there's a couple of other students who also will get it, whatever you're teaching, they're going to get it, but they're going to need 14 repetitions, 17 repetitions. That is very classically our students who deserve and benefit from Tier 2 services, a little bit more extra. That's all. They're not needing something different. They just need more. And we have to figure out in systems where there's not enough time, not enough money, not enough people, we have to figure out how to do that. And then in this group, there is one student, sometimes there might be a little bit more, but there's one in this group of 10, who is also going to get it. You can teach her how to outline. She will learn that blend or whatever it is you're teaching, the math fact. But she's going to need 49 repetitions. That's not going to happen this afternoon. It's going to need to be distributed over time. It's going to need to be consistent, engaging for her because, you know, the 13th time, the 8th, the 17th time, the 27th time, we got to keep going on this, so we have to figure out how to do that. This could be our representation of a student who would benefit from Tier 3 services. So the acknowledgement, just I'm acknowledging, and you already know, our students are different and need differentiation. So these days, one of the ways that almost all schools, and I'm seeing this model, multi-tiered support systems being implemented, not just in the United States, but around the world. It may be beyond English-speaking countries, but I primarily work with English-speaking countries. The evidence is pushing us in this direction. MTSS did not just come around at some ivory tower where people sitting around with nothing to do, and let's come up with a new model for instruction. It evolved over time from very brilliant people looking at the data about what works. What works? Intensification of our instruction is what works for all students. Just providing core grade level instruction, one size fits all, is not appropriate. So looking at decades of research, this model has evolved over time. And we've started to use these terms, Tier 1, Tier 2, Tier 3. Now, I will acknowledge that when you usually hear somebody talking about MTSS, you see a triangle, right? Sometimes people flip that and it is a pyramid. Maybe you've heard Stephanie Staller talk about her vision of MTSS, and she has created this really cool thing called a cone. I am not that clever. I can't make 3D images, but there's a good cone. I got a little bit bored with all of those things, so I turned it on its side. This is the wedge. Okay. This is the MTSS wedge. Everything else on it is just like you've always seen, that most students, all students should receive, or certainly most students should receive Tier 1 instruction. Some students are going to need and deserve some extra instruction. We might call that Tier 2 services. I try to be very careful to never refer to children or students as Tier 1, Tier 2, Tier 3. They are not the tiers. They receive services that we have structured in tiers. And there will always be, no matter how hard we work and how exceptionally good our Tier 1 and Tier 2 instruction is, there will, for a variety of reasons, always be students who need and deserve Tier 3 services. So the only reason I turned this on the side for the wedge, because everything else is the same, I added that arrow across the bottom because I wanted to use that as a way to emphasize, while the number of students may be decreasing based on our excellent early identification and intensive intervention, the number of students needing more intensive instruction may be decreasing. To get there, certain things need to be increasing. That's the purpose of the arrow. So it's not one size fits all in terms of time. Some children will learn with significantly less instructional time. Some students need extraordinarily more time. So that's one of the things that increases as we move across the tiers of service. The intensity of the instruction should increase. Carolyn talked a little bit about that yesterday. I'm going to talk a little bit more about it this afternoon. Intensity is increased in many different ways, making the number of students you're seeing smaller. One-on-one is the most intensive. A group of 3 is more intensive than a group of 5 or 6. So we intensify the instruction through smaller groups. We intensify the instruction by narrowing the focus. We're not taking the whole core grade level curriculum. We're taking a narrow part of it. We're zooming in, as Carolyn talked about yesterday, zooming in on a piece of the instruction that this student of the curriculum, that this student needs. Increasing the pace, really moving through things at a rapid pace. There are different ways of intensifying. Data collection increases. We do not need to spend our precious time, money, and people collecting the same amount of data on our students who are thriving in Tier 1. It's Tier 1 where I'm seeing the overuse of assessment. So we'll talk more about that. And then the third thing that I attach to the arrow across the bottom is expertise. And what I always want to explain that, because I'm not saying that our colleagues who work in Tier 3 are more expert than anybody else. I mean, I would hope that we have the experts in instruction in Tier 1. Let's do massively exceptional, wonderful Tier 1 and put our smartest, brightest, skillful people in Tier 1. Didn't Carolyn, I think, say yesterday, the hardest job in the school? It's not smart or training or background or credentials. It's more brains at the table. We do hope and expect in many cases that a classroom teacher in charge of Tier 1 can do that all by himself or herself. We hope they get some support, but that's sort of the model. That's one teacher. When we get to Tier 2, it's the classroom teacher plus at least one other people, 2 brains at the table working with these children. And when we get to Tier 3, depending on the needs of the children, it might be a whole team of people. We might need psychologists, we might need psychiatrists, we might need social workers, we do need special education teachers, along with our partners in the regular classroom, and parents and others. So the team simply gets bigger. There's a parallel to the world of medicine. I'm not a doctor. I was not trained in medicine, but I do watch The Pit. Oh, isn't that a good show? Oh my gosh, I'm just learning so much about the world of medicine. And I've watched other medical shows, so I know something about how it all works. I've also run this by some of my people that I know. I wouldn't call them colleagues, but people that I know who are doctors and physicians. So like, am I somewhat on the right track? And every doctor, physician that I have shared this with said I am, generally. Although they don't use, I'm kind of taking our language. I've never heard a doctor say that they use the terms Tier 1, Tier 2, and Tier 3. But the concept is the same in the medical world. There is the largest group of patients is all of us. Every human being would be considered by the medical profession to be one of their patients and clients. And in Tier 1 level of services, you would perhaps go at least once a year to see a medical professional, get your annual checkup where they collect some data, screening or benchmark data that everybody gets, whether you're a world-class athlete or somebody with a chronic illness. In your annual exam, you're going to get your blood pressure taken, your cholesterol checked. They're going to look in your eyes and your ears and do that weird thing with the knee and measure height and weight and all that. Everybody. That's universal. In that process, physicians are going to find a few of us who are going to need something more than just an annual exam. We're going to need a little treatment, a little lifestyle change. We may have broken our leg or something, and we need some treatment, perhaps temporarily, from a specialist. And that specialist would work in conjunction with the physician to plan a treatment and get us back to the point where we are healthy and well and only need Tier 1 services. In this model, Tier 3, I am imagining the pit, the ER situation. There is somebody who has had a horrific accident, or they are seriously ill and need to be transported in the back of an ambulance to services that we could think about as Tier 3, but they would be the most intensive. Perhaps the most intensive would be intensive care. And there, it would be a whole team of people. So that really does align with that notion of expertise. There are going to be a team of people, nurses and doctors and surgeons and technicians and others as needed to help you get through that crisis and get back to wellness. So what increases is the amount of time. In Tier 1, we could envision just going to the doctor once a year for that, now what is it, 15 minutes that they have to spend with us? A short visit with the doctor, collects data, says you're fine. Tier 2 is for whatever the issue is, you're going to be spending more time with that doctor. And in Tier 3, it's often a 24-hour, hopefully not for many, many days, but sometimes it is. It's very, very intensive. So the time is different, the intensity of the services is very different, and the data collection is very different. Tier 1 is screening and benchmark. We'll screen you to see if you're at benchmark on your cholesterol, your height, weight, all the other stuff that they're looking at. You're at benchmark, then I don't need to see you again. Keep doing what you're doing. You're not at benchmark. Your cholesterol's really high, your blood pressure's really low, whatever it is, let's get you some Tier 2 services to get you back at it. Data collection in intensive care. Watching TV, it's 24/7. They're hooked up to all kinds of monitors that beep and buzz and light up, and that's purposeful. If we just treated intensive care patients, or not we, be careful here, if physicians treated intensive care and the only data they collected was stop by once a year and check their blood pressure, that would be completely wrong, but it's very appropriate in Tier 1. So I like the analogy. It works for me, so I'm going to continue it as we go along here. So what is the purpose of all this data collection in the medical world? To efficiently, we're doing all these assessments, to efficiently collect appropriate data to enhance professional decision-making. It has a purpose. It makes professionals smarter. We want to be efficient, collect appropriate data, to enhance decision-making. Efficient because it's not data collection that's the most important thing. We don't have, I agree with Croth and his colleague, we don't have enough time, money, or people. So we have to do it efficiently. It has to be appropriate, and it's appropriate if it informs our decision-making. So that leaves a question. What is the appropriate data that informs decision-making? Well, I'm glad that researchers who have looked into this have some guidance for us in this. This is the work of Matt Burns and many, many people who have come before him have determined that, and they've determined this, what I'm about to show you, or you're already looking at it in your handouts if you want. They've determined these key questions and tell us that we all in the field should use these questions to guide our data collection. Why are they strongly saying you should do this? Is because this is the way they determined this was decades of looking at highly successful schools. This is really one of those moments where observational data has greatly informed our profession. Let's go out and look at a highly successful school and let's see what they're doing, and then let's copy it. you know? And we don't do that one school. We do school after school, year after year. We look at urban schools, rural schools, high schools, elementary schools, public schools, charter schools. Let's look at them all, and let's look for a pattern. And assessment researchers have found a very clear pattern in highly successful schools. They are focused for their students on key questions. They want to know which of our students, who among our students here might need some extra help. And I'll talk more about why this is sort of a not a definitive question. We're willing to say, which of the kids might need some extra help? That's first question. Once we have found a student who might need some extra help, the question that highly effective schools use is, okay, what help do they need? We figured out they might need some help. What help do they need? And these two questions would take our schools really far, but the very best schools ask another question. After they use the results of these two questions to design and plan instruction, the third question comes after instruction is happening. And it is, I often talk about this third question as the bravest question a professional can ask, because we're asking, is the work working? We assessed our students, we designed some good instruction or intervention, we're doing it to the best of our ability, we've got a coach watching us, everything seems to be going great. Now we have to ask the really important question, is all this work working? Students working, I'm working, is it working for this student? So when you have this framework in place, which I strongly recommend that you should, that it's not, this is, by using these questions, it's one of the ways to do, I think I use later in this presentation the term a data audit. Look at all the data you're collecting and see if that data overlaps, because that's the problem with too much assessment, is that we're answering some of these questions multiple times. And that's not efficient. We can't use time, money, or people to answer the same question multiple times. In a data audit, you also might find that you're missing some assessments, that some of these questions are not being answered efficiently and effectively. So this is a framework for your data audit. But once you have these questions in place, then you know what assessments to use. To answer the question, who might need extra help, you want to find some good, effective, efficient benchmark screening assessments. And at least in elementary school, these would be administered universally. These are our blood pressure, cholesterol, height, weight assessments. To answer the question, what help does this student need? That's diagnostic skills. It's a whole different category of assessments. And here we switch and we only assess individual. This is another mistake I see schools doing. They found some diagnostic assessment that they really like, and they spend the time and the money assessing all the students who are already at benchmark. Is the work working? That is the category of assessments we call progress monitoring. And just like the diagnostic assessments, these are individually administered. So let's walk through what the assessment process looks like, whether you're a physician or a teacher. For a physician, let's imagine the annual exam. You've made your appointment, you're there, you only waited for 35 minutes in the waiting room, everything's good, you finally get in to see your physician. Hopefully this is a highly trained person, and ideally this is someone who knows you and has a history with you, and they might start this process by, just let me know how you're doing. I'm going to be doing all these benchmark assessment. I'm going to be taking your temperature, checking your blood pressure, all of those kinds of things, but tell me how you're doing. Is there anything I should pay particular attention to? But this physician is engaging in, for their profession, what would be called benchmark screening, and everybody gets these assessments. As an educator, we do assessments to answer a question. Our question is, at this early stage, who which of all these students in front of me might need some extra help, those universal benchmark assessments that we've learned to administer at the beginning, middle, and end of the year. We identify, choose some benchmark screener. We administer it, and we compare the score to a benchmark established, and we're going to find that some students are significantly below benchmark, some are slightly below benchmark, and some are at or above benchmark. So here's something I want you to pay attention to. This is something that's a little nuanced, and it's a mistake that I see a lot of schools make. If you administer a benchmark, which are usually those super quick, they should be, super quick, very efficient benchmarks, and you find a student who's at or above benchmark, what that tells you is this that I'm going to show you right now. It tells you that that student is likely on track. I'm going to pause and let that sink in for a minute while I take a little sip of water. Likely on track. These often 60-second assessments that we're doing, or computer-driven assessments that we're doing, like who knows what that kid's doing over there, those assessments have to be, those results need to be taken with a grain of salt. I am a big advocate, some of you know, of some of those benchmark assessments, the use of oral reading fluency, letter naming fluency. I'm going to talk about those a little bit. But they are not designed to be highly precise and super accurate. They're reasonably accurate so that we can be efficient. That's why we do it. But that's why the question is this, which of our students might be on track? When a student is at benchmark, it is likely, it's very likely, I can show you decades of research that show you should believe that they are likely on track, but you should also understand that a human being can be at benchmark and not be on track. We heard yesterday about children who, Catherine's discussion about kids who are at benchmark and still have problems with comprehension. We need to keep those things in mind. Those students who are below benchmark may usually do, but again, especially when they're at the edges, do they need some intensification of their instruction assistance? Maybe. So that's all that benchmark screening lets us know, which kids are likely in which category. They don't answer further questions. To do these assessments, more and more people over the last 40 years are using curriculum-based measures. And I know it's about 40 years because these things didn't exist 50 years ago. They were invented. This whole suite of assessments was invented about 45 years ago or so. Assessments that were designed to be reliable. You can trust the results. They're designed to be valid. They give us useful information. They're designed to be quick and repeatable over time. And CBM measures exist for reading, math, spelling, and writing. And I assume most of you in this room and watching virtually are familiar with these CBM reading measures of letter naming fluency, letter sound fluency, etc., including oral reading fluency. Nowadays, 40 some years after these were invented, some entrepreneurial people figured out that they could package these assessments and sell them to you, and added some bells and whistles and charting and graphing and all kinds of things. And now you don't have to, as we did 40 some years ago, to do these assessments. We had to create our own assessments. Even ORF, just go find some passages for the kids to read. That's what we did back in the early days, and that was the suggestion of the early CBM researchers. Just create your own assessments and assess the students in your school. So you all know now, everybody pretty much is doing these things. We have students orally read passages or letters, lists of letters or words. It's always supposed to be a cold read. Generally, the protocol is a one-on-one assessment for 60 seconds. In every case, we're supposed to elicit the student's best effort. I'm going to pause again on that one. If I were doing a workshop here on these assessments, we would now spend about half an hour talking about that. because this is an area where schools are going wrong on using these wonderful assessments. They are either encouraging students to do this as fast as possible, or they're allowing students to do it as fast as possible. Both of those things, telling the student, ooh, last week you were 120, see if you can get to 150, that invalidates the test. Or allowing a student to just, okay, the gorillas live in the jungle and they all climb the trees and they eat, but like, no, stop. Invalid assessment. It is the whole design, the validation, the norming of these assessments were done by asking the students to do their best effort. And also for only 60 seconds. I heard a horror story while I was here that some of the researchers were looking at a school where all the kids were doing really, really well, and went and looked at their assessment, and they were allowing them to read for, extra time. 75 seconds, 90 seconds, because, well, they stumbled on some words, so they need some extra time. No, these are standardized assessments. They look real casual and little, and boy, in the olden days when we were creating our own assessments, it looked very casual and informal. But the protocol is standardized, and they work, and we can trust them only if we use the standardized protocol. If you want to know more, get this book, The ABCs of CBM. I love this book. So these reading skills develop over time. We talked about that a little bit when I showed you Scarborough's rope, which I'm going to do again. So we can use, I think, should use, I'm going to use that word, use these measures across the time as kids are developing their reading. And these are not typically, as I've seen, the labels for development that everybody uses. Ari has her phases, and Chal has her stages, and Louisa Moats has some terms that she uses, but I think these suffice for what I'm trying to show you here today. At the very, very early stages of reading, pre-K to early kindergarten, we might use the term emergent. And I acknowledge that for a neurotypical kid, this is where this typically happens, but I don't work with neurotypical people, so I prefer not to use grade level labels, because I certainly have worked with adults and adolescents who are at this developmental stage. But to just sort of orient you, I'm using the grade level. At pre-K, early kindergarten, we have really good, reliable, valid, efficient, effective, trustworthy assessments that we can use to answer that first question. That's the question we're answering. Which of these kids might need help? Letter naming fluency and letter sound fluency will put kids into categories of strongly on track, probably on track, might not be on track, and really not on track for this really complex thing called reading. It kind of boggles my mind, but it does a really good job of that. Once our students are in mid-kindergarten, these are all, kind of like Nancy's colored continuum. It's sort of vague where students are, but let's call that the novice stage. Then we pull out word reading fluency and non-word or nonsense word fluency. We probably want to poke around in their phonics skills once they get to this stage too. And we're always paying attention to language, because it's not just the bottom of the rope, it's the top of the rope. When the students typically by about mid-first, sometimes earlier, sometimes a little later, to early second, we might call that the transitional stage. They're reading decodable text, but they're moving into text that might not be quite as decodable. The assessment, now we can use ORF. Typically by middle of first grade. Some people are now doing ORF at the beginning of first grade, but this works really nicely as an answer to that question of which of our students might need help. By mid-second grade, as we all know, all students are now skillful readers who fluently read text, and that continues for the rest of their career. Yes, we all laugh in this room, but there are some children by mid-second grade. That's where the Seidenberg and other neuropsychologists are saying that's where the magic happens for most neurotypical kids who have received good instruction. Politicians have given us to the end of third grade. And that's just a political move. You know, there's like, come on, let's squeeze some more kids into effective reading. But it should, and it does, happen right around early to mid-second grade for most children. And the assessment here, we can continue to use the ORF. I have some question marks about there. We really don't have time for this discussion, but I'm just going to tell you that there is no research that I'm aware of, that I've ever seen. There's no research that says once we have identified an established reader, that there's a mandate to test them 3 times a year for the rest of their elementary career. Once kids learn to read, unless they have a traumatic brain injury, they don't unlearn reading. Now, does it continue to progress? That might be a question we have for kids that are at the bubble. But if they are strongly established as a reader, they have what Seidenberg calls achieved velocity, and you can document that. I am not saying don't assess them at the beginning of the year. There's no question mark by the beginning of the year. Let's assess every kid universally at the beginning of the year after second grade. But those kids, you know, maybe you don't work with them, but in a school, there's going to be these kids that they're progressing, and it's great to see that. We don't need to assess them in the middle of the year and the end of the year. That's what I'm saying. That there might be policy and there might be laws, I'm going to acknowledge that, but there's no evidence to say. And I would say the best schools figure out how to do less testing. The kids most of us in this room probably work with are these kids who don't just move along the development step by step. They often get stuck right here. Our middle schools and junior highs are filled with kids who are right about here in their reading. They've learned to read, but they're not at that fluent, skillful reading. They're kind of stuck at second grade, third grade, early fourth grade reading. Middle schools are filled with these kids. High schools are filled with these kids. Our prisons are filled with these people. For these students, we've already identified they need help. So we switch to that other question, that other category of assessment skills diagnostics. Program evaluation is something that we can do from screening data. If your school is collecting high-quality screening data, you should be using this not just to look at each individual child and how they are doing. Are they in need of extra help? Are they making progress? But you can use this data to look at the effectiveness of your program. If consistently your second grade kids are not moving along toward benchmark, that is not an individual kid issue. That is an instructional issue, a curriculum issue. There's deep, rich data that we can, that data is deep and rich, and we can use it for far more than simply assessing individual students. So the physician has done that assessment. They did all the benchmark assessments, and actually they found something of concern. So then the whole process would move to another stage where the physician might say, your cholesterol is quite high. Your blood pressure is very low or very high. Your weight, you've lost a lot of weight mysteriously, or you've got this pain, or you're not sleeping well, or whatever it is. What we want their headset now to switch and say, let's figure out what's going on. They would switch to a whole new different set of assessments categorized as diagnostic assessments. In their world, this is what I get from TV, really. I'm sure this is not an exhaustive list, but seems like they do x-rays and CT scans and biopsies and more extensive blood tests and all those things. This is a different category. We don't go into our doctor and expect them to x-ray every bone in our body and do a CT scan and do a biopsy of every organ in our body. That's ridiculous. So this is reserved. These are individualized decisions that the physician makes. At this stage, the educator's question is, what help does this student need? We found a student that is not at benchmark, or we think they might need some extra help, and then we move to those individually differentiated diagnostic assessments, typically following the benchmark screener. For those students at or above benchmark, we always can do additional assessments if necessary, like those students that are at benchmark but we suspect are having comprehension difficulties. We can assess them. For most students, though, if they're at benchmark and we have no additional concerns, or their parents don't have any additional concerns, we can just not do any more assessment, go straight to our job, which is that provision of instruction. For these students, this is where diagnostic assessments usually kick in. We want to know a little bit more before we design their instruction that they will be receiving. Part of your handouts, I shared this little diagram that I have often used in my trainings and when I write about assessment. This diagram is all about efficiency, not over assessing kids. It's for diagnostic assessment. So this is used after benchmark screening. We would start with our youngest students at the bottom of this. We, following their benchmark screening to figure out what help do they need, we might do an assessment of phoneme awareness. We might do some more work around letter names and letter sounds. Can they read high-frequency words, looking at a Dolch list or something like that, or that San Diego Quick that I mentioned yesterday. Let's do a little spelling with these children. Can they spell or encode the words? If we find, remember, these are the kids who are not at benchmark, and it is likely at kindergarten or first grade, we're going to find that they have some weaknesses in this area. So we don't need to do more assessment. We're always going to take a breath here. We're always going to be checking their language. But for many kids, we can stop assessing. Don't spend any more time collecting data once you've identified that these are their weaknesses, because these are the foundational skills. Stop testing and use your time, money, and people on instruction, because I promise you, you don't have enough time. You don't have enough money, you don't have enough people. We want to catch these kids up. It's absolutely possible, but not by doing more testing. If these students who were not at benchmark do really well on these foundational assessments, I would suggest moving up, even at that young age. Check out their phonics and decoding. Then for older students, we move to the top of the chart. Older, this is like mid-first grade, so these kids are 5.5, right? 6 years old. That's what I mean by older. Once students are reading text, we start at the top, and we start the assessment by having them read a passage. So this is beyond benchmark. This is now a passage. It could be a grade level passage. If I know they're significantly below benchmark, I might start with a passage that's below grade level, but I want to hear them read. I am going to be timing the first 60 seconds very covertly. I just want to know what their words correct per minute is in the first 60 seconds. I'll run the timer the whole time because I have found very interesting about things like stamina. Our kids who struggle might do quite reasonably well anyway at the top, and then it just fades off at the bottom. So, and I show the student, I use a stopwatch on my phone, and I tell my students, this is what I'm doing. See, I have a timer here. I'm going to put it out. Well, I won't put it on the table because I don't want to distract them, but I'm using a timer because I want to know how long, I just always write down how long it takes to read the passage. So a little bit of a white lie because I am assessing their first 60 seconds, but I just do it as casually as possible. And most of the students I work with now have been timed so much, they just like, okay, whatever. And I always let them stop the stopwatch at the very end and say, oh, what was the number? Can you tell me what number was? And I'll write it down, super casual. What I'm doing is making a little mark on my protocol at 60 seconds. So what I'm looking for, I'm going to have them read. I'm listening for their accuracy, their fluency. I'm going to ask them some questions to check their understanding. If they are fluent, they didn't pass the benchmark, but if they are fluent on grade level text, and that happens sometimes, I'm going to stop my assessment. But what do I mean by fluent? What's the criteria for me to say you're good? you're able to read unpracticed, grade level text with sufficient accuracy, and we learned what that was yesterday from Catherine. At least 95%. The research is very clear. It needs to be that high to be reasonably accurate. Appropriate rate, I would consider words correct per minute from the Hasbrook and Tyndall oral reading fluency norms. I included this in your handouts for those of you who don't have that. This goes up through 6th grade, but those of you who work with older students, our research has shown that the 6th grade norms can apply to older students. We have significant research on that. What we want is somewhere in the 50th to 75th percentile. Higher than that, kids are probably reading too fast, is what we know from that. We also want to hear reasonable expression. If they're using suitable expression, it's an indicator that they actually understand what they're reading. So that's very important. And then we're going to check for understanding, because reading just words, even if you're accurate and fluent, that's reading words. That's not reading. Reading involves understanding what you're reading. So I'm going to do a little check for understanding. I have been schooled. I do not say I'm measuring students' comprehension. If I ever said that, I don't anymore, because I have listened to my comprehension gurus, including Hugh Katz and others, who say it is very, very difficult to truly measure a student's comprehension, because comprehension is so incredibly multifaceted. It is very individual because of background knowledge and attention span and all kinds of things. School psychologists and other researchers have figured out how to measure comprehension in a way that we all agree that's as good as we get. But those assessments take 2 to 3 hours, at least, is the only way to truly say at the end, I know this student has good or weak comprehension. When we have a student read a passage and we ask them to do a retell, or we say, can you tell me the main idea or the gist or those kinds of things, we're getting a sense of their understanding. We are checking their understanding, which is related to comprehension. But as a professional in this field, I want to use my terminology really precisely. And I worry deeply, and I know Hugh Katz does too, and other people, when teachers administer a little assessment with a 4-item test and the kids do well and they say, yep, they have good comprehension. Oh, be cautious. Or the 4-item test, they don't do well, and the teacher says they have poor comprehension. Are you really sure about that? Or maybe you just had a really bad morning. Their parents had a fight in the minivan. Their breakfast was 3 donuts, or they didn't have breakfast. Or they just didn't want to answer your stupid questions. That's a different issue than comprehension. So if you're not already very cautious about that term, comprehension, it's the goal of everything, but it's really hard to measure. So our proxy for that is checking for understanding. All right? Maybe you can talk to me later about that if you want to. These students are often, in my experience, not at grade level. They're not fluent on a grade level passage. So for most of them, I'm going to go down and do a deep dive in phonics and decoding. Of course, and if they're really low there, I will even go further down the list. But a physician individually administers diagnostic assessment, and we do too. For the physician, after they have administered that diagnostic assessment, they're going to come back to you. This might be the same day, it might be a couple of weeks later, and the scary conversation, here's what we found. Sometimes it's not so scary. You thought you broke your arm, indeed you broke your arm. Sometimes it is a little scarier than that. But it's going to be a 2-part conversation. The physician's going to say, here's what we found, and you know what you're waiting for. Here's what we plan to do. And this is where we really divide the medical world and the instruction world, because when they say, here's what we plan to do, the list is very exhaustive. All kinds of surgery, drugs, physical therapy, nutritional changes, behavioral, environmental, you need to do more exercising or whatever. It's a long, long, long list of potential interventions. Very different from us. We have one. It's called instruction. That's all we do. The instruction, of course, is going to be highly differentiated, but our treatment plan is one-sized. What we're going to do is instruction. Then, for a physician, I want a physician to follow up and say later, 6 months later after my cast is finally off, or I've been doing the exercises or taking the vitamins or whatever it is, I want them to check on me. A physician might say, how are things going? Are you feeling better? And hopefully they would follow up with some progress monitoring data. And this, of course, would be individualized. You don't do the same tests on somebody who had a broken leg as somebody who just had spinal surgery or something. It would be individualized. The educator's question at this point, is the work working? I said earlier, the bravest question you can ask, because you're turning it on yourself. This is not about the kid. Is the student making progress, but I'm responsible for it. They are making progress or they're not making progress. That's on me. And that has to be individually differentiated. For all of us it should be, and that should be that stopped me a little bit. This is the educator world that I'm talking about, not the physician world here, that we do need to differentiate our progress monitoring, and it would be different for those students who appear to be thriving in Tier 1 and the students who are receiving services in Tier 2 and Tier 3. We would do more based on their need. But in Tier 1, I hope students are receiving instruction in small group on a daily basis, on a regular basis, and then we observe their performance. We look at their written work. If you're using a good, well-designed program, it should have some in-program assessments. Carolyn talked about that yesterday. For young students, 3 times a year progress monitoring. For some other students, maybe not 3 times a year. I mean, the benchmark screening can serve as progress monitoring as appropriate. For our students who need and are receiving appropriately targeted Tier 2 and Tier 3 assessments, we can continue using those CBM assessments. Whatever we used to identify the concerns, we can use those as progress monitoring. There's lots of good data on that, lots of good research to support that, and lots of good support for that. Intervention Central is a good place to get protocols to do those frequent assessments, and there are websites and everything available to us. The general guidelines for interpreting progress monitoring data, and if you're graphing that, I didn't really mention that, that's what I'm talking about before. We can do those 1-minute assessments and often put them on a graph, as it says there. If on the graph you've created an aim line, what your goal line is, and there's procedures for doing that. If most of the dots are on or above that aim line, it's you need to keep, attempt to raise the goal. We don't want to keep them where they are. We want to increase the challenges. If they're neither above or below the aim line, keep going with what you're doing. It seems like, let's give it a little bit more time. It seems to be working, but it might not be all the way there yet. And continue monitoring for sure. If most of them are below or well below the aim line, you might keep your current goal. Don't lower the standards, but the intervention, the work is not working. So let's modify the intervention. Modification might be, how frequently are we doing the intervention? We might need to consider that. And then, frequency of progress monitoring. Yes, frequency of progress monitoring. Should we do it weekly? Should we do it every 2 weeks? Should we do it monthly? I left question marks there because we do not yet have good evidence to guide our decisions on that. Decisions about frequency of progress monitoring are very much a professional gut feeling. But if you go back to what I was saying earlier, we should do more frequent when the needs are greater. Remember that yellow arrow across the bottom? More assessment, the higher the need. So more frequent progress monitoring for our students who are significantly behind. If you've never seen a progress monitoring chart, I hope that's not true for any of you, but here are some. This was part of a study, actually, this was a study that Carolyn Denton did in her years in Texas. This was an interesting study because they studied all the kids, the regular kids, the Tier 1 kids, the advanced kids. Everybody got weekly progress monitoring. And the aim line was created for expected progress. So here's a little girl who we typically wouldn't be assessing her because she's just moving along week after week after week after week. Her progress is absolutely where we expect it to be. So that's lovely. We would only do this. I want to be sure this is for a research study. Once a student's reading like this, weekly progress monitoring would not be justified. Here's a little student in the same study. Steady progress, steady progress, steady progress. Whoa, something happened. This child somehow accelerated himself. We need to change the student's program. We need to keep up with him. Here's a more typical what we see on progress monitoring. No progress, no progress, no progress, no progress for enough time that we say we need to stop. A lot of progress monitoring charts, you see a line driven. Okay, we're stopping, we're making a change here, an intervention line, it's sometimes referred to. And these people did that. They made a change in their program, and it got off to a little bit of a slow start. So a few weeks later, they said, this isn't doing it. They stopped again, made some kind of change in their instruction, and voila, it looks like exactly what we would hope. But I work in the real world. You work in the real world. So this was another student. You know, same hard-working teacher, same diligence to paying attention, same effort to change the intervention because it clearly wasn't working. They did it a couple of times and they got a little blip at the end. Because I'm talking about the similarities, the parallel between physicians and teachers, I often look at this almost flat line and say, well, and this was 2 weeks ago on an episode of The Pit, I saw this. The line was going in the patient's monitor, and then all of a sudden, it's just flat, and all of the people, all the physicians and nurses in the room just sort of stopped, and then at one point, one of the nurses went over and said, time of death, and that was in that show. That's a difference with us. When we see a flat line, we don't say time of death, take them out, we're done, we can't do any more. No. We are the ones, we keep pulling out those paddles. Okay, that wasn't enough. Let's shock them again. Let's do it again. Let's keep going. We are relentless and ruthless. What do we do for the kids who are accelerating or not making progress? We have to change what we're doing. Are we doing the right thing? Are we doing a really super evidence-based, terrific fluency intervention, but the student's problem is comprehension? We have to make sure our intervention is matched to the need. Is it a good quality program? Is the instruction of high quality? Are we doing a carefully designed program with fidelity? Are we doing it a couple of times a week in a large group? Maybe we need to intensify the instruction, make it more frequent, make it longer. Who knows? I mean, those are individualized decisions. Back in 1999, I co-authored an article about a teacher who was actually involved in the pilot studies of curriculum-based measurement. She was a teacher in Minnesota, and these CBM measures that I've been talking about, oral reading fluency, et cetera, were invented at the University of Minnesota. She was a teacher in the school district, and the researchers used that district to pilot test these assessments, to test them out. She was asked, this is Candice Einot was asked to do that, and she didn't like it at all. She had never done assessments like this. It was very uncomfortable. She really objected, even went home to her husband and said, I'm going to quit. This is too much. I want to teach, not test. I don't like this. And Tom, her husband, said, well, Candy, if you want to quit, you can quit, but we have 4 children. The eldest is about to go to medical school, so it would maybe be good if you didn't quit right now. So she went back and did this CBM stuff and learned to love it. So this article, which is available out on the internet, is the story of her transformation from hating this to saying, If they tried to take it away from me, I would go in my closet with a flashlight and I would do this because I can't teach without it. So I talked about that philosophy earlier, and one of my pieces of philosophy is we need to use the results. If we're going to spend all this time collecting data, let's use the results on a regular basis. Share, discuss, and use student data to inform our work. We know that this is important. School teams that use data are more efficient and effective, and the students get better, and it's all good. We want to collect data that improves a student's life. We want to collect data that serves as a flashlight, not a hammer. So I'm going to wrap up now. Let's get us all out to break by putting this all together in a lovely framework that I like to use, outcomes-based model based on the work of Roland Good and colleagues, an outcomes-based model, which walks us through this process of how to make a data-informed decision. Step one, we identify students at risk, asking that question, who might need some extra help? We use a benchmark screener to do that. Step two, we found students who might need help. Now we determine students' individual needs. We ask the question, what help does this student need? We turn to our diagnostic assessments and we administer them strategically. Not everybody gets a CAT scan and a biopsy and an x-ray. We do it strategically. Then we use the results to plan our instruction. We don't just make this stuff up. We have a plan based on the students' identified needs. Step three, we implement the plan. Ta-da! We bring out our sword of instruction and we implement the plan. Step four, of course, we're brave, we're professionals. We want to know, is the work working? So we bravely monitor our students' progress by making individually administer the frequency, the type of progress monitoring would be individualized. We monitor our students' progress, and then in step five, we use the results. We're either going to make changes, and that's not always obvious or easy to figure out what those changes are, but we sit around hopefully collaboratively and think about what's not working, what can we do. Let's just start with a little wine and cheese, whine about we don't have enough money, we don't have enough people, we don't have enough money. Okay, we don't. Now what are we going to do with the time, money, and people that we have? We make changes, or things are working, ta-da, we continue the plan. So I want to give you some resources, some things that I recommend highly all the time. This brilliant book, just revised now in its second edition. This is Susan Smart was here yesterday in this audience. She lives down the road in Mount Juliet, and she has partnered on a couple of editions now with a woman that I've co-authored with, Deb Glazer, to write this practical book, Connecting Assessments to Effective Interventions. Just the other day, I got a email from a curriculum director at a school district in Wisconsin who said, we need to do, my reading specialists have been through letters, they know a lot about assessment, but they need to know what to do with kids at 11 o'clock next Tuesday. And I said, get this book. This is the book you want. And people have done book studies on this that are on YouTube and things. It just walks you through how to take those assessment data and charts and graphs and just lovely. So here, you administrators in the room, or you all work with a building administrator or a district administrator, buy this book for them as a little Administrator's Day gift. This fabulous book called It's Possible, designed for K-8 educational leaders, written by Patty Montgomery and Angie Hanlon. It is super, super practical about the title. It's Possible comes from their belief that it is possible that 95% or more of children can be taught to read at grade level. They absolutely believe it, and they have proven it in their work. And they talk about the stories of taking a very, very stressed, very low-performing school and bringing it up to 95% or better. It's possible. So the whole book is how to do that. And of course, they talk about using data to do that, gathering and interpreting data, and using data, collaborating with colleagues to do that. If you are intrigued by MTSS or you're doing it or you like a little few guidance about that, there is a tax dollar supported. It hasn't been shut down yet. We'll see how that goes. But there is a center, federal center on multi-tiered systems of support. Michigan has been doing this for a very long time. Kim St. Martin is the head of this center. She's been doing MTSS for decades now, and they have fabulous stuff available for free on the Michigan website. Sarah Brown and Stephanie Stoller wrote this book recently, MTSS for Reading Improvement. I think it's very good. And Stephanie partnered with Kate Wynn to write this wonderful book. They sent me a copy after it was published and asked me to write a little blurb about it. And I read it, and I thought it was wonderful, and I contacted Stephanie right away and said, I was about to write a book, and now I'm not going to, because you just wrote the book that I was going to write. So I think this is fantastic. All right, key takeaways for this talk. I strongly believe, I hope you do too, that educators should use data from assessments and other sources to plan, deliver, and evaluate our instruction. We should be using diagnostic and progress monitoring assessments, and we should differentiate them, just like we differentiate our instruction. Benchmark screening in the early grades is one size fits all. Everybody should get it. But we should differentiate because we want to spend the time, money, and people on instruction. Data should be collected to answer key questions. My dream for everybody would be to do a serious data audit and shut down all your computers, put all your stuff away, put them back on the shelf, take a deep breath, and then start with your questions, and then see which of our assessments, or if we don't have one, let's go get them, but what assessments efficiently, effectively answer those questions, and pick one to do it. And then if it turns out later that one's not answering your question, throw that one away and pick another one. Don't just layer them on and on and on. We are spending too many resources. Assessment data needs to be collected, it needs to be shared, and it needs to be used in the classroom to inform our instruction. All of this is an excerpt from chapter 4 that's in your Climbing the Ladder of Reading book. So now you don't have to read that chapter. Oh, you can if you want to. Thank you. Let's all go for a break. Karen, do you need to say? Yeah, okay. Don't leave yet. Thank you. Thank you very much. I surprised you by ending a little early, okay? it is.
Extra caffeine. Thank you. Wonderful. I know you all enjoyed that as much as I did. We're about to post the attendance code for the morning. Just get your paper, pencil out. I also inserted, as soon as the slide comes up. Okay, no email, no problem. Don't panic. You can do the Google form. Here's a QR code. Just take your pick, okay? If you got the email, do that. If you want to use the Google form, I don't care. We just want to make sure that we are verifying your attendance. So write down the attendance code, which is going to be shown in just a minute. It is data, all caps, DATA 36, like March 6th. Data 36. There it is. Write it down. That's your attendance code for this morning. All right, have a good break. We'll see you at 10:45.
leave that there because I'll use that later. There we go.
right, let's get started with our next presentation. Okay, so the morning attendance code is DATA, D-A-T-A, 36, all caps, no spaces. D-A-T-A, 36, all caps, no spaces. DATA 36. We are now going to hear from Dr. Vicki Gibson, who will be talking to you about managing differentiated instruction. And Dr. Gibson is a national educational consultant, author, and speaker specializing in early childhood education, differentiating instruction and collaborative practice, classroom management, reading instruction, and special education. Dr. Gibson has taught regular and special education classes in public schools for 10 years before owning and directing 4 private preschools that served children ages 2 through 12. She taught at Texas A&M University and authored numerous professional development and comprehensive educational curricula. From 2008 to 2020, Dr. Gibson was the owner and chairman of a professional development consulting company, Gibson Hasbrook and Associates. From 2018 to 2023, she was the founding director and owner of the Charlotte Sharp Children's Center, a full inclusion research child lab and preschool serving children ages 2 through 6 on the Texas A&M University campus in College Station, Texas. Gibson sold SCC to Texas A&M University and joined the faculty as a professor of practice in the College of Education and Human Development, Department of Teaching, Learning, and Culture. So please join me in welcoming Dr. Gibson.
Okay.
There you go. That's it. Okay. The green to go forward or to go back?
Thank you for inviting me back to Tennessee. You talk like the people in Texas and you eat like the people in Texas, and it's always a joy to come back here. The first time I came to Tennessee, I went, my people, they're over here. But you have a beautiful state and really wonderful people. So I've got an hour to try to teach you how to manage differentiated instruction. So we're not going to spend a lot of time with getting into the weeds on so much of the research, so I can get to presenting to you and providing for you a couple of tools that will make your life a lot easier. So first of all, the meaning of differentiating teaching, differentiating instruction, it simply means teach differently. A lot of people, a couple of authors have written that it's content and process, and don't get in the weeds. When you need something to work for you, you need a simple tool you can use, you can have faith in, that you can manage flexible grouping. That's the problem with differentiating instruction. So how many of you are in the classroom now as a classroom teacher? Raise your hand, please. Okay, how many of you are instructional coaches, supportive staff, and how many of you are administrators? What are the rest of you doing? No, I'm just kidding. But the point that I'm making is when you're in whole class, this is whole class, this is an overview, it is not instruction. Teaching occurs when you can give explicit information with feedback. And that's impossible in whole class. And so what we want to do is talk about flexible grouping, where we are alternating opportunities to work with our students in whole class and small group. And the difficulty for many of the teachers is managing flexible grouping. What differentiation is not is having the teacher plan multiple lessons, use various different kinds of activities. That is too much work. And all students legally have the right to attain the same learning goals. What we have to do is scaffold that instruction. It's easier to do it in small group instruction. So let's see what we're going to do. What I have said, and Jan and I have worked in every state in the United States, I think, and I've seen so many different models, but they're not differentiating the behavior of the teaching. They're differentiating the content, the materials, and student practice. What I want to talk about today is differentiating how you teach, and how students participate. So, what's the evidence there on research and evidence-based practices? There isn't a teacher I've ever worked with that has told me that they don't want to work in a small group. Most of them do. But the questions that I always have to answer is, what are the rest of the students doing? And how many students are in a small group? And I'm going to address that. It's the flexible grouping that challenges us to be able to pull off truly differentiating teaching, but you need to differentiate practice as well. So what I'm going to show you is a tool you can use for whole class, overview or quick review. You may model, you may talk about new content, but you are not teaching at that time. It's pure overview. I always work on vocabulary, word, meaning first for everyone. And there's all kinds of fun games you can play in collaborative practice that don't involve using the hand, like password and hangman. But what we're looking at is not that you can just read the word, but do you know the meaning of the word? Or can you use it in a sentence? And we use a timer sometimes on students. How fast can you put that word in a sentence? But we have got to change the way we teach so that we enhance student comprehension and achievement. So what is the research on collaborative practice? This will make you feel better sometimes as a learner. How many times do you think that you need to hear something new or old information used in a new way? How many times do you think as an above average IQ adult, that's most of you, and not the students you teach? How many times do you need to hear that in a repeated practice before it's in short-term memory? Turn and tell somebody next to you 15 to 17 times. Do it now. Turn. 15 to 17 times. Now, those of us that are older, we're glad because that means we're not early candidates for dementia. 15 to 17 times. And people, that's only in short-term memory. That is not in long-term memory, what we call knowledge for application to use it as a skill. How many times do you think you need to know it for long-term memory? I'm going to give you the answer because we're in a hurry, 35. You should write that down. Now you see a huge error in teaching. You also see a huge error in the way curriculums are developed. We've had this discussion so many times with publishers, we being Jan and I, because your habit and your expectation when you review materials is what you're teaching and what the students practice are on the same page. It infers that's what assignment you should give to a student on that day. And when you look at the cognitive research, you see it defies everything we know about learning. So one of the things of differentiating instruction that's the easiest for you to do is take your teacher edition or whatever you're using as a guide for practicing and teaching, is you need to use Post-it notes and assign the days later in the week that you're going to use that assignment for collaborative practice and especially for independent practice and homework. All the bad research on homework, it's not homework that's the problem. There is a recent study, Duke University did it, that any homework assigned below age 11 has not had any impact on student achievement. You might want to put that in your notes. It's in Duke University's research, and they just published it. 60 years they reviewed data on homework. It's the way we use homework. We assign the activity before they've had the repeated exposures to take it from short-term memory to long-term memory, knowledge, and apply it as a skill. If you want better behavior and more student participation, adjust the pacing so that it goes, they get overview and whole group, they get explicit instruction and feedback in small group, they get to practice collaboratively with their peers, and you go, well, what about all those activities? Use whatever you're using now, but let them complete it together. Let them talk, let them share, and I know what you're thinking. Oh, I know who so-and-so will just sit there and copy. People copying a good model is better than sitting there and guessing and not doing any work. And is it a little bit unethical to grade development as mastery? Where should your product be, if you wanted to call it that, assignment be? What product are you using to estimate achievement or learning, or have the student demonstrate learning? That should be an independent practice. So you're seeing that pace of instruction in a timely sense be differentiated, and that small change will make a huge difference in the outcome of student behavior and achievement. By the way, I want to say this because I didn't put the slide in here because I don't have the time, but to explain it, but I would strongly encourage all of you to look at Karen Hess's work, Karinhess. She is the guru in this country that looks at rigor, which is the cognitive demand of what you're teaching, on student learning. And she has produced the learning progressions, and she's got some wonderful downloadable resources on her website, Karen Hess, because she is the person that has looked at the science, at the research, and developed learning progressions of how students go from hearing it, seeing it, understanding it, being able to talk it, and then they are able to perform. So your learning triangle is hear, see, say. Can the student hear it correctly? Because a lot of their sound system is different from yours. Hear it correctly, see it, understand it, not just read the word, people. We want them to read so badly, and I do too, but if they don't have comprehension, they're lost from the moment you start talking. These vocabulary words are very important. Hear it, see it, say it. The collaborative practice is where they get that 35 exposures that you don't have time to get. But the problem is that I've run into is, one, we don't trust the students to stay on task and get their work done. If you let them work together, you'd be amazed at how much work they get done because they don't sit there afraid to even take the risk to start. So let's talk about the grouping. Most teachers tell me they can use their data to inform grouping. What is the number of groups that they recommend in the research? There isn't a number. I will tell you about the studies done at University of Texas by Sharon Vaughn. They looked at, is it more impactful for intervention? They were actually looking at, does reading recovery work? So is it more impactful to have one adult with one student, one adult with 3 students, one adult with 5 students? That was the study. And the outcome of that study was it had nothing to do with the number of the kids in the group. It had everything to do with the teacher's purposeful action to adjust what they were doing in that small group. Say it differently, model it, reteach it, slow down the pacing. It has everything to do with what you can do as the teacher to change or differentiate the way you teach. And what I like for the teachers, I've opened 9 schools, I've owned 4 of them since 1984. I've never had a teacher write an extensive lesson plan. I want your time spent on how can I make this make sense to the kids in that group. And we all have the lesson basic content, and we all get the same or would like to achieve the same outcome. But I have to differentiate how much I feed the baby in each small group. So I'm going to give you a word picture so you remember this. How many of you have ever had children, a 2-year-old, and the pediatrician said spinach would be good for your child? They hate spinach. It's green, it's ugly, and it stinks. But you've got to feed it to them. Now, I want to just get an enormous tablespoon of spinach and shove it in that child's mouth. But what they do is spit it back out. That's called the spinach is your instruction, and the spit it back out is a student's behavior when they react. You've got to be smarter than the average bear. You've got to scoop up just a little bit of spinach, dip it in applesauce, that's differentiation, and put it in that child's mouth. into their learning system. And when they spit it back out, you're going to scoop it back up and stick it back in there and tell them it's good for them. That is repeated exposure and collaborative practice. So the question I want you to always say to yourself when you look at an activity, when you look at a lesson, when you look at a student, you say, how much, how fast can I feed the baby? And you'll remember, pacing has to be adjusted per group, but not different lessons. In fact, Tim Shanahan has recently written a book that's published by Harvard Press about the mistakes that we have learned from using leveled materials, dumbing down lessons, lowering our standards. It's a very interesting read. All right, so one group is going to be with you in teacher-led differentiated instruction. What are the rest of the students doing? They're in collaborative or independent practice, and how are we going to manage that? First of all, I want to tell you what a student told me once in Santa Ana, California, 8th grade. There was a teacher there that had been teaching probably 30 years. And so I was presenting to a group, and he came up afterwards and he said, you know, that sounds just fine, but how do you make that happen? I have over 150 students a day. I don't even know their names. And I said, there's your first problem. If you don't have a relationship with a student, they don't trust you. I always work with the most at risk. That's my favorite. My favorite student actually is a boy with the highest academic need and the worst behavior. Those personal conversations, it builds trust. But I had an 8th grader in that class. We did the study. We went in and trained for 2 days. They had it, man, because 8th grade, they get it. When they get to work with their friends and share their work, they're with you. And this girl looked at me and said, I said, what is it that you like about this new way of him teaching? And she said, because he knows me, and he knows my name, and he knows I try. So it's that personal relationship that you develop in that small group. And you have informal, ongoing assessment nonstop. You know those kids better than anything on paper because you're in their face. They can't hide in a small group. We just can't help ourselves. You know, teachers, we're going to correct you anywhere. Walmart, HEB, you name it. My own children would go, Mom, this is not your school, and these are not your students, because I want to go correct somebody in a restaurant. I do, unfortunately. So the repeated exposures and pacing must be aligned with rigor. And people, rigor is not hard, it's not difficult. Rigor is what the cognitive demand of the content, the lesson is on the student's learning system. How hard is it to the student? And that's one of the things you really need to look into, because if the rigor is high, then your support must be high. And what we see is we may see grouping in kindergarten, pre-K, grade 1, grade 2, but it's interesting that we see less use. In fact, 80 to 83% of the teachers report after 2nd grade, they use whole class instruction for their teaching method. And 80% of that time, they're doing all the talking. It defies everything we know in the research about learning and rigor and the demand on the student. And what happens is when you're in small group and you're not adjusting the support for that rigor, you see what's called the allostatic load start to rise. That's your tipping point, and that's why those students act out. So if you want to see better behavior and more student participation, I can't encourage you enough to make the lessons make sense and do it in small group. So how many of you have these tools already? Any of you that have ever been in a classroom have a daily schedule, but I'm going to tweak it just a little bit. And then a job chart. You know, a big Harvard study just came out, and it was a longitudinal study. In fact, it was on social media a whole lot about a month ago, that the 2 factors that really were the correlates of highly successful, independent, well-functioning adults was work. Give them chores. They want those young, and in my schools, our pre-K starts at 2. Our 2-year-olds, I can match them with any 4 or 5-year-old in a regular program because we have routines and procedures and we have work for them to do. And once certain students that need to be working instead of hands on their friends, they have jobs every day. So a rotation chart. How many of you used a rotation chart before? Absolutely. This is not genius work. But when I started teaching, I had 43 5-year-olds with a shared teaching assistant. It was the first year that kindergarten and special ed was in public schools. I didn't know what I was doing. As a matter of fact, I called my school back and asked for a refund because I did not know how to teach. I had a lot of content in my head. I had no methodology in my head. So I just copied what all the other teachers. I decorated my classroom. It was real pretty, but it wasn't effective. And so we're going to look at these tools real quickly. Well, we hope so. All right. The first thing you've got to think about is if I'm going to differentiate instruction is I've got to be intentional but flexible in my thinking. That means I've got to be willing maybe to give up some of my favorite old habits or maybe my belief system. Let's drop that dialogue and talk about what's best for kids. So we're going to change that classroom environment. We're going to create work areas, and you don't need to go buy furniture. I've had so many people go, well, I don't have a table like that if I have pictures. So I took the pictures out. Just think about a work area. I'm standing at the door of my classroom, where would I like to work with a small group? People, the older they get, the more they like to sit on the floor. You don't need to buy materials. But it's an area where I'm going to have court, as I call it, teacher-led explicit instruction with feedback at the point of need. And then I've got to think about where would I want them to collaborate and what do I want them to do? And then where would they work as independent practice? Well, independent practice is easy. It's wherever you've assigned them to sit at a desk or a table. So really you have to just think about where am I going to teach and where are they going to practice together? But you also have to think about routines and procedures. What will work for me? What can I tolerate? What can I consistently follow through with? And what will create a safe boundary for participation? How will I teach my students to communicate respectfully when they're speaking both to adults and to children? So this is the label of where the teacher teaches, and I started using it forever ago, and unfortunately it has stuck. So I've had to keep that. Teaching table. It doesn't have to be at a table. If I'm using technology to assist and with understanding something new or a concept or a model of skill, then it could be over at the computer. If I am going to introduce something and I need a whiteboard, it's wherever that's located. My teaching table is not permanent. It's wherever I need it. It can be on the floor. It can be in chairs. I don't care where you put them. It's just designate an area that day, that week. It's not always so rigid. I move my teaching table, my small group, wherever I can provide the best instruction and feedback, and monitor RTI, response to instruction. And you know what? If you monitor response to instruction, give the feedback and correct it at the point of need, you don't need response to intervention. So teaching table. All of the teachers tell me they love it. But what's important, again, when we interview students after we've implemented this, I thought they would all tell me their favorite change was collaborative practice with their peers, starting their homework together at school in collaborative practice. I thought that's what they would report. Almost every one of them said, my private time with the teacher at the teaching table. They want your attention. They're going to get it one way or another. They have it guaranteed when you meet with them in small group. So work table, it's another area in my classroom. Now I'm going to assign the group membership. You don't tell me who you want to work with. I assign who I want you to be with. In the beginning, It's completely by who will get along and not create war. Compatibility. Because I'm introducing something new, a new routine. You don't introduce new with new, it's new with old. So I'm not focused the first 2 or 3 days up to a week. I've never had it take longer than 3 days to make this change. Maybe with the 2-year-olds. But what I want you to do is them to get along so they leave you alone so you can teach. So I group totally by compatibility, and I can change that in a nano when I figure that I've got oil and water in the same group. So compatibility. So they're assigned to a family, a small group. That family will come to my teaching table. It is not optional at the time that I tell them. And they will also go to a work table. That is early guided practice. I keep the group together. There is no choice about that. They go to the work table. They are seated somewhere and working on an activity, just like you use out of your curriculum, but they're doing it together. I don't care about a product. I care about developing understanding. So if you think about it, then at the teaching table and the work table, half of the kids in my class just about are seated, parked somewhere, not moving. I don't know about you, but when I'm focused, I want to teach and I want to look up and see if there's water anywhere, and if not, get back in my lesson. I don't need a lot of movement out there. Then workstations, some people call them centers. When they get older, we call it collaborative practice. It's still student-directed, and they've been introduced to the content in whole class. They've been taught at teaching table. They've got more repeated of practice at the work table, and now it's at workstations. And there I do give some students, depending on age and the content and the time frame, the choice, because I use student contracts. And so their work has due dates on a calendar, so they can go work on that. And so I don't want to be preparing materials every day. I set up my classroom and it runs for 2 or 3 days, and I don't have to switch out these materials. And then independent practice, wherever they're assigned to sit. I don't even care if they work on the floor with a clipboard, but whatever you do, complete the activity and demonstrate learning. Got it? So, well, I think your little thing is about to die. All right, so let's look at daily schedules. In all of my practice for, and I hate to say 4 to 5 decades, the hardest thing for me to get a teacher to change is a daily schedule. And the reason is it's a representation out of your daily habit. It represents your habit and what you like to do. Even when the data's showing you it's not working, it's very difficult for me to push you. Adults don't like our habits changed. But all I'm asking you to do is alternate time periods for whole and class instruction. And I'm going to show you how this works for multiple situations. This is just an example. Everybody say example. Because I've walked out and they go, my kids don't come in at 8:15. I don't eat at this time. This is an example. So how do you change your daily schedule? You write what time they come in your room, what time they leave your room. I don't care if it's 45 minutes or all day. What time they come in, what time they leave. Put in anything that is permanent that you can't change because it upsets the schedule for other people. Lunch, recess, library, technology, whatever it is. And where you see gaps is where you go, I can fit in a small group there. And these groups are only going to be maximum 12 to 15 minutes. And why is that? Because if you study the adult ability, above average IQ adults, this research is done on, your ability to sustain and focus learning attention is only about 20 minutes. Give or take 2 minutes for the standard error of measurement in the research. So that means that an above average IQ adult can lock in with primary learning attention 18 to 22 minutes. Now you see another fault in our instruction. Cognitive overload, where you are right now. You've got instructional salad in your head because a lot has come at you really fast. And you leave here with a million good ideas, but what the research shows us is that by the time you sleep 3 nights, you'll go, I know I was there. But what you can't recall because it was only in short-term memory. So what you have to do is review your notes. And if you have access to these PowerPoints, you'd be wise to talk about it with a friend. Because the more you talk about it, the deeper the understanding gets, right? So what I want you to do is look at a daily schedule and manage the instructional time differently. What does the research say about students? This will blow your mind. Their ability to lock in primary learning attention. If you don't understand what primary is, you have 2 kinds of attention, primary and secondary, and I could send you to secondary in a nano if I had the time. Well, what's interesting about the research is once a kid downshifts their fight or flight and back brain functioning, you cannot make them shift back up. That is one of the behaviors, that is one of the things we come predisposed with. How many of you can take a whole lot of stress, but when you finally tip, they need to leave you alone? Yeah. That's excellent research out of the University of Washington in Seattle. But anyway, what I want you to do is alternate. Now notice here I have 4 small groups. Look at the teaching, the balance of teacher-directed versus student-directed. We've got shared use of instructional time. And one of my own colleagues complains that small grouping is too difficult and it wastes too much time. I will guarantee you we only waste 5 minutes in between those transitions because we have established routines. We waste less time doing this than we do trying to manage behavior in whole class. So in the morning, let's say that's what it looks like. In the afternoon, I only use 3 small groups, but I'm using the same type of small group instruction for the rest of my core subjects. And people, even if this isn't your class, maybe this is what you take home to the people who are in your school district that are teaching in classrooms all day. We have to adjust the way we teach. We have to adjust how we teach using small and whole class instruction. Again, look at the balance in time. It's perfectly even, teacher-led and student-led. When we only have class periods that are 55 to 60 minutes, you have to group a little bit differently. Still using 3 groups, you can use 4 groups. Some days when I've got an interruption, some special project or whatever that's going on in school, I can use 2 groups. But what I've got to give you is a tool how to make that happen, and I will. But notice, and this is the way we do it in middle school and high school, you're still meeting with the groups, but you only get to meet with them 2 times a week, either Monday and Wednesday, Tuesday and Thursday, and then I will call students back on Friday, or they can volunteer to come back to my teaching table if they've got additional questions or want more explanation. It works all the way from age 2, and I used it in college as well. I couldn't move the students and I couldn't move the desk when I teach in college, but I can darn sure talk to about 3 rows at a time. What are the rest of the kids doing? I make them bring their books to class and read with partners and teach them how to read strategically, like conversations, so it goes in. So this is a rotation chart. Now this is an elementary one because that's what's in the book by Hasbrook. I call her Hasbrook. But anyway, we go way back. I'd love to tell you some of the stories we got into. We were rebels when we were teaching college together because we had both been in the field more than any other faculty, and we knew the real world. And so we challenged some of their belief systems. We got laudy degrees from that. They were thanking the Lord we were gone, when we left. But this roadmap explains everything, whether you're an administrator, supportive personnel, paraprofessional, students, parents. One look at this chart, I know who is in the group, I know the order of their activities, which if you look at the research, predictable order is the only correlate that lowers stress in an environment. And if you don't believe it, think of you. You like your habits, and you like to know what's going to happen to you. And we lower our stress about something new when we know what's going to happen. We love predictable order, and that comes with routines. So looking at this rotation chart, it identifies the groups, and those names are up there. The whole chart is a piece of poster board with Velcro. It's the cheapest tool you can buy for classroom management. And do they have their handouts? Do you have access to it? So the rotation chart that I'm about to show you is available to you then. It identifies the order of the activities. So I have some students, I taught 8 years as learning disability specialist. So the worst of the worst in my entire district were bused to my school. I loved it. I loved them. But they'd already had sometimes a contentious bus ride. They were coming into me not ready to be teaching. So I could position and plan their order of activities until they settled down by letting them go to collaborative practice, not coming to a teaching table. I could even adjust what happens to a student simply with this chart, and I'm going to show you how it works. So it makes efficient transitions, and I don't change the chart. I have a job. A student comes and changes it. But the biggest report that teachers tell us is, first of all, it makes their day go very quickly. It's just like that. And lower problems with behavior problems because the students know what to do, who they're going to do it with, and when they're going to do it. Settle them down. So here's what the rotation charts can look like. So in elementary, they tend to call it centers. In upper grades in elementary, they call it workstations. In middle school and high school, we call it what it is: collaborative practice, independent practice, and explicit instruction. You can write any name you want on your chart. It's how you use this chart. And if you lose your access to it here, email me. I'll gladly give it to you. So I just take the chart you're going to have access to. I take it down to a copy center for $3. They blow it up. Do not laminate it because the Velcro doesn't stick. Learned that the hard way. It doesn't. And I even made my own. All right, so let's look at how this chart works because it is the best tool I have ever offered anyone. So the top of the chart is all about memberships, right? The bottom of the chart is about participation. And so the icons, and what in high schools, they typically use the names of colleges that these students might go to. It could be the names of favorite sports team. It could be the theme if you're a thematic curriculum. I don't care what you name the groups. I'm using color because I don't want you to pay attention to the name of a group. I want you to pay attention to the operation of the chart, okay? So how did I group them? In the beginning, collaboratively, so I don't have two kids that don't need to be together. But I have another way of keeping them apart. If I have a group at the teaching table, that's a seated activity someplace with me. But in centers, they have choices sometimes because I like to use student contracts. I'll start that at age 4. That they actually get to choose where they want to work on because I'm going to give them a couple of days to work on those activities to complete them. What we want to do, because somebody did it to us, it's assigned, you have to finish it, and that's it, and I'm going to grade it for achievement. That's not fair if you know the cognitive science about how we learn. So I don't want those two kids ever in the same place at the same time. So if I have that student, let's say it's Liam in the yellow group, and it's Jenny, and they're best friends and worst enemies, I make sure that they travel side by side, their group does. So one is always seated either at teaching table or work table when the other one has any choice of activity. The only time they get together is when they're out of my room, and even then I have to set some routines, right? Well, we have a lot of kids referred into my schools. All right, so I'm using 4 small groups right now, but you can use it for 1 or 2. So how do we change during transition? I have a student, we call it chart caller, you can call it anything, that comes to the chart and they take the one on the far right and they lay it down. And the reason they must lay it down is if they hold it in their hand, they get confused with these. They're on with Velcro. You take it, lay it down, move the red one over. Now the group at work table will be going to centers. Move the blue one over. That group's going to be going to work table. Move the yellow one over. That one's going to centers. And I bring the green one up, and they're at teaching table. Everyone knows what to do, when to do it. How do I signal a transition? Depending on the age of the student, at early, young, 2, 3, and 4, we have a student called the timekeeper. It's usually the child in my class that absolutely cannot manage and get anything done on time. So now they're the timekeeper with a timer, and they have power, and kids love power with jobs. And so they go around 5 minutes before we're going to make a transition, and all the little ones do is show it, which tells the kid, start thinking about getting yourself organized to change, right? And honestly, people don't believe it, but anybody that's ever been to one of my schools, we can make these transitions in less than 2 minutes because it's their habit, because we've taught it, right? So I'm going to just manipulate the icons, whatever you use, at the bottom of the chart, and I'm going to do that 4 times in the morning or 3 times if I'm using 3 groups in the afternoon, so that I see every student every day in small group for differentiated instruction. And remember, that time is only about 12 to 13, 14 minutes. And I know what you're thinking. I can't possibly teach it. If you can't get what you have to say done in 12 to 15 minutes, you are over their ability to handle primary attention. Your brain will naturally go grocery shopping. All the people that think they have ADHD, I hate to tell you, but the brain naturally goes grocery shopping about every 20 minutes. So, come on, darling. So job charts. How many of you use a job chart? People, this works at home too if you've got kids. You can, I don't even care what they look like. So most of the teachers use a pocket chart because I'm not a big believer in you creating a bunch of stuff. I'm a believer in you thinking about how you can teach and be effective. But it teaches leadership. It teaches tolerance because we have to teach students how to speak respectfully and not demand it. We have to teach them the difference of assisting and doing it for them. This gives us so much time, such an opportunity to develop them socially, to live in a real world we call our community classroom. Do a job chart. And that Harvard study is the one that you can look up if you're interested, that just was published about the importance of giving kids chores for when they are in a community situation. All right, so how do I know what jobs? I tell all teachers, make a list of everything you do, everything. Check supplies, pass this out, whatever. Make up a funny name for it and call it a job. Half the kids in a class have a job. They work for a week in that job. So week 1, I'm going to forget academic pressure. I'm going to set the routines and procedures in my environment. I'm going to coach these kids. And if you ever want to see what you look like, week 1 students train week 2. And they're bossier than you ever thought you could possibly be. They have less tolerance. You have to work on how to speak respectfully. So you can have chairman of the board. The chairman of the board makes sure all the chairs are in the right place. I love my favorite job that I ever developed was counselor, all whining, griping, fussing, fighting, lost items, and stories from last night. You go tell that kid. And you laugh, people, but it works. So I am very strategic about who gets assigned jobs week 1 because I'm going to be their coach. So the child that's in my class that shows no tolerance and all they do is whine and gripe, they're negative, Make them the counselor. It breaks some of the habit. I was in San Antonio, Texas, and we had this model going on. And I remember the counselor rolling his eyes and going, I need a vacation. I went, yeah, welcome to my world. And so make up the jobs, but you have to take the time. And you're like, I can't. I have to get everything done. How will I get all this done? People, you give up on academics for a week and you set that environment. You have plenty of time the rest of the time to make that. It's important we teach what we want, and we clarify expectations, and we train and practice what we want. We can't assume students know how to do school. You've got to teach the routines and the procedures of how to do. And as a group on a campus, I would have a lot of discussions of what works for you, what works for me, and work on those routines together. Because once you set this in motion, every year those kids carry that behavior and that structure up with them. The superintendent in a school in our district said, I can tell every time there is my teachers tell me that every time they start the first day of school, they can tell which students came out of one of your schools. And I went, oh, really? I was going to be proud. I thought it was a compliment. And he said, yeah, they're aggressive. Well, they are when they come in, some of them. And I went, what do you mean they're aggressive? And he said, they say if they don't get started, that your kids take over, organize the class the first 20 minutes. I said, don't get assertive and aggressive confused. These kids know what works for them, and they want it. I had two students in the 5th grade at another campus, and the teacher didn't use small groups. And they kept hounding her to try it. And finally, she tried it, and they taught the whole class what to do. Once you set the habits of a good learner in that student, they seek it and want it. I use this, and this is a 2-year-old in our class. This is from CSCC. We teach decision making. How many of you work with students that can't make a decision to save their soul? And then they grow up to be adults that can't either. They go to the mall, it's so confusing, they buy a cookie and a Coke and go home. We've got to learn to focus. And so we teach it with a choice board. And you can see the one on the left, all we did was buy some of those cheap athletic cones, and that's what we put out where the workstations are. If there's no cone, not open. I don't want to listen to blocks today because I'm doing informal assessment. No cone, accept it, and make a second choice. So, and we have a wand, and we teach them to speak in complete sentences. This is 2-year-olds, and we do it all the way up. I want to play, and they use pictures. We take pictures of where the options are when they can't read. This is not hard, people, and it works, and the kids get it. So, where do you begin? You get the materials together and start talking and thinking, whether you're talking to yourself, which you know what the research says, that your brain loves your voice better than anything else, which what does it hear most of? If you ever really want to deepen your comprehension, then read out loud, because you read slower, and it's a familiar voice, and you read like conversation. But I want you to plan. Don't just jump right in. Now, I have had teachers that over the weekend completely changed their classroom and pull this off. Good for the racehorses. But the rest of us need to kind of plan what we're going to do. The most important thing you've got to plan is what choices can I live with, and what will be the consequence for noncompliance. Don't let them catch you off guard. Be sure you always just, by the way, this works on spouses and everything. But what we do is we set ourselves up for a failure by asking questions. What do you want for dinner? I don't want to cook. So I say, what would you like for dinner? Ham and cheese, tuna salad. Get it? That way it stays my choice. Start thinking about that. I wrote a whole book on 2-choice discipline. All right, so the first thing you do is you get your materials together. It'll cost you less than $10, guarantee you. The next thing is you've got to model, teach, practice. Teach those kids what you want and how to make it happen, and compliment effort, not just achievement. Coach them, people. If you've ever had a good coach, they didn't tell you do it. They showed you how. They practiced with you. They complimented your efforts. They gave you constructive, not criticizing feedback. So, what do you need to do? Get with your peers. Get you some Post-it notes. Open your teacher resources, your guides, your lesson plan. Think about how fast can I feed the baby? Differentiate when you have students work independently. Which activities work great for early collaborative practice at the work table? That I'm not going to grade. You're developing understanding, enhancing your comprehension. I'm not interested in mastery. Which activities are best for independent practice? I allow all students I have all of my life start their homework at school. If you don't think they won't hurry, whenever chance, as soon as if they don't have a job, they run back to their desk and work more on their homework. And people, that's family-friendly instruction. Some of these kids are in extracurricular activities and sports. It is mean to assign 3 hours of homework. And it develops a bad habit in adults that creates workaholics like Jan and I. So, the repeated exposures. I want you to count. When I go through a teacher edition, I'm reviewing curriculum, I look at the scope and sequence and think about Karen Hess's learning progressions. I post and note how many times that concept or that skill is repeated, because if it's not enough, that's where I'm going to add more. And I might bring that same activity, one of them, back in 3 weeks from now, because I want my students to come back and go, that was so easy. We never compliment their success as much as we criticize what they didn't get right. So I want you to think about using that curriculum a little bit differently, and I'm not asking you to buy new curriculum or furniture. So why do we need to change? People, the world has moving at such a pace, and our job to get students ready for this future that we can't even imagine, we need to rethink what we want students to know and be able to do. This is Atlas. How many of you are following the developments of humanoid robots? If you haven't, you need to be looking at it. It's where the world is going. If you don't believe me, you use AI every day. And some of the states, including Texas, we're trying to grab those screens and get them out of the classrooms. People, we shouldn't punish technology for our misuse of it. When we allowed students to have Chromebooks and unfettered access, that's our fault. We model screens constantly in their presence. If you don't believe me, go to a restaurant. So we need to look at, in fact, any of you that are driving a BMW or a Hyundai, those are completely assembled in a robotic distribution center. No person touches them. And the cool thing about these robots is they work 24 hours a day, change their own battery every third hour. People, please look at where it's going. We need to be thinking as how can technology assist us with making learning make sense. I would use it at the teaching table where I can monitor its use. Texas has passed, I know there are 8 states now that have got limits on the minutes of technology. We can only use it 60 minutes, but if you read the fine print in the law, it says unless it's explicitly used for instruction and is in your lesson plan. So all you do is write AI, but I would prefer you write AI, Adult Assisted Artificial Intelligence. I'm using it to enhance my lesson and maintain their interest. What's interesting is when you look at this one, Optimus. These are being developed 90 miles from my house by Tesla. In fact, they are no longer producing the S version of Tesla because they've converted those to create these robots. They will have 100,000 of them ready by December and 1 million in a year. And by 2030, the estimate is that everyone will have a personal robot in their house, and they'll cost about $20,000. Now, why do I point this out? It's because we've got to think about how do we get students where they are to where they might have skills for where they need to have for working, employment. And this is a dyslexia conference, and I actually have some ethical questions because I understand all the content, but how do I support a child when I can't get to them? Would I use technology? And my first thought when I heard about this particular tool was, oh my gosh, they have to learn how to read and they have to learn all the skills. How many of you have seen the ScanMarker Pro Air Reader? It is not ready for prime time, I think, yet. I have one with me. It's in my suitcase. They're too expensive, but as competition gets, it'll drive that price way down. They're about $190, I think, now. One of them translates into 12 languages, one translates into 20, but that's not my interest. If I had students out in collaborative practice or independent practice, and they didn't understand a word or a sentence, would I give them AI so they continue working and they don't get frustrated? I think I would, because I can't get to them. I'm over in small group. So I'm not against using AI to support learning. I'm against how we opened up and gave kids too much access, too much freedom. And that's the problem, I think, with technology. So I don't advise buying this yet because I think the technology will be grossly improved within a year and the price will come down. But it's certainly something that we need to think about, especially for our struggling readers. We've got to get support in their hands, and sometimes there's no support at home. So managing differentiating instruction basically means change how you teach and how students practice. Alternating time periods for whole group, whole class, and small group instruction, and you can do it easily. Now, one more hint. I have a daily schedule with all those time periods on a big piece of chart paper, and I mean big enough it can be read from anywhere in the room. It's on the same bulletin board or wall next to the rotation chart. Now they know when and how, and no student better ask me what's coming next, because it is their responsibility to self-regulate, not my responsibility. My job is to teach. Their job is to learn to be a student and be successful at it. So, my grandmother used to tell me this all the time. If you always do what you've always done, you will always be what you've always been. So my suggestion is dare to be different. Look at a better way, a simple and cost-effective way. I will guarantee you that it will change. It's a life changer to have management. Now, on that rotation chart, I want you to think back about what I told you. It can use 2 groups, 3 groups, 4 groups. It's totally flexible. All you've got to do is change the icons and the group memberships and their own with Velcro. Very easy to change. So, if you're interested in the most recent research on the impact and use of or abuse of AI, this is an excellent report, just came out. It will get you up to date on what's going on and the way it can support instruction. Thank you for your time and attention. I got to catch a flight, but I'll hang out for a few minutes for questions. There's my email. If you have a question, you can email me there. I've got to catch the flight pretty quick.
Okay, we're going to break for lunch for 1 hour. We're going to come back at 12:45 Central Time. Your morning code, data 36, all caps, no spaces. The afternoon code will be shared at the first break. See you at 12:45. Hi, sorry we're getting a couple minute late start. We are going to start the afternoon. Just to wrap up this morning, your attendance code is DATA, D-A-T-A 36, all caps, no spaces. The Google form from, the link from the RedCap was, I did make sure that it was reopened this morning. So you'll have until like the first break to use that link for day one, and then I'm going to close that and open up the one for day two. But again, you can always use the Google form if that is what you prefer. It is fine, or if you did not get an email yesterday. In the Google form, you're only going to complete it one time and use all 4 codes from yesterday and today if you attended all the sessions. You're probably so sick of hearing me talk about attendance codes. I apologize. We would just give out certificates to everybody, but we want to make sure we verify, especially because ALTA is giving CEUs for this. So we need a way to verify attendance, with integrity. So, all right, our next speaker is Erica Jones. This is going to be our last official presentation of the conference, and then we're going to close with a Q&A and then a closing keynote by Dr. Hasbrook. So that is what the rest of our conference will look like. And so Erica Jones is going to speak to you about the deep reading brain for learners who are deaf/hard of hearing. And so you can read, because I did get a little bit of a late start, I'm going to refer you to page 31 to read more about Erica Jones. But I do want to just give you a little bit of her background. She is the manager for the Georgia Department of Education's Deaf and Hard of Hearing Early Learning Intervention Program. She leads a team of approximately 125 contractors throughout Georgia who provide in-home and virtual weekly services to families who have a child who is diagnosed with hearing loss. So please do look on page 13 of your program and read more about Ms. Jones and all of the fabulous work that she does. So I would now like to welcome Erica Jones to the stage.
Oh, the dreaded after lunch, second day presentation that I drew. How many of y'all enjoy presenting? Raise your hands. You are a special, special crew. So before I worked with the Department of Education, I worked at a school called the Atlanta Speech School. There were many programs under the roof of that school, but the one that I led was called the Catherine Ham Center. It was both a preschool and a clinic for children who are deaf or hard of hearing, who are learning to listen and talk through hearing technologies, so through listening and spoken language. The executive director at that school, he was with me before our presentation one time, and he said, "Erica, I can see how nervous you are. Just think about presenting as sharing something that you love." And so that's what I'm doing today. I'm looking at this as an opportunity to share what I love with you. All right, so I'm here today to answer this question: is a deep reading brain possible for learners who are deaf or hard of hearing? But before I get started, I want to tell you a story. And when I tell you the story, you're going to be like, why did they put this girl on the stage? So I got to Murfreesboro yesterday. Murfreesboro. Is the R after the F? Is it silent? Do you say it? Murfreesboro. Okay. So I got here yesterday. No, I got here the day before. But yesterday morning, before I came here, I got up in what I thought was plenty of time to get ready. I gave myself some time to take a walk. I came back to the hotel, ate some breakfast, and got up to my room, the 4th floor of the hotel, and got in the shower to get ready to go. Well, the walk took longer than I expected. I lollygagged at breakfast, looked at this presentation a little bit, probably not as much as I should have, did a little Facebooking, and I got up to my room and went, oh my gosh, I need to leave here soon. And so I got undressed, got into the bathroom, and I opened up the shower curtain, and there was 2 knobs, the faucet, the shower head for up here, and then there was a handheld shower head. So, I've taken a lot of showers. I've been in a lot of different hotels. I know how to use a shower. But I turned on the water for the knob with a knob that I knew turned on the water, and I assumed the other knob just decided which one of the three things the water comes out of. So I turned the bottom one, turned the water on, and then I turned the top one, and I turned it all the way around and all the way around, and nothing was happening. I'm like, oh my gosh, like I've got to be at this conference. So I just start turning it. Like, if I turn it faster, maybe it'll work. But it didn't. And so I called the front desk and I said, hey, I can't get my shower to work. And the sweet lady at the front desk said, you know what, someone's going to be here in 20 minutes. Just hold on and we'll send somebody up. And I went, oh gosh, thank you, but I really have got to take a shower now. And so I said, is there maybe another room I can use? And she said, how about I come up and see if I can take care of this for you? And so she did. She left the front desk, came up to the 4th floor, and she walked into the bathroom. I had put all my clothes back on at this point. But she walked into the bathroom, and she turned the bottom knob to turn the water on, and she turned the top knob. She noticed that nothing was working, and so she looked down at the faucet, and she pushed the button on the faucet. And boom, the shower worked. Like it was just a button, and it was right there. But I'm going to come back to that story in a minute, and so that'll make sense. Okay. Does this work? Do I just push this middle button? Nope. This one? Nope. This one? Nope, that's the wrong way. Green button. There we go. Okay. I don't have any disclosures. Nobody's paying me to be here on behalf of anybody, so I don't have any disclosures. Okay. This is my heart. This is my husband, our 4 boys. We have 4 teenage boys. We shop at Costco a lot. 3 of them are in college. 1 is still in high school. And then on the right are our 2 furry animals, and Bailey and Dexter. And yeah, they're incredible. Just right. Okay, so back on track. Here's our question was, can children who are deaf or hard of hearing have a deep reading brain? Well, let's first define that question, right? What is a deep reading brain? Our friend Marianne Wolf, who Jan mentioned in her first talk with us, she says that a brain that is capable of engaging in these things behind me are classify a deep reader. So inferential reading, they can construct their own, they can construct new knowledge. They have analogical skills. They can make connections. They can critically analyze. So they can evaluate the truth. They can reflect. They can access higher order thinking. And they have insight. So they can connect what they're reading to their own personal experiences. I've heard this summarized this way, that a deep reader is somebody who can not just decode, not just knows vocabulary, not just can read fluently, and all of those things, but they can put themselves into the shoes of the reader. They can determine who they want to be, who they don't want to be, and they can make a difference in the lives of others. So that's a deep reader. Okay, so we've defined that. Now let's define deaf. What does it mean to be deaf or hard of hearing? The first term that you see up on the screen is big D deaf, or a deaf with a capital D. This is a cultural identity. This is a community of people who have their own language. In America, it's American Sign Language. And they are connected by this language. They're connected by culture. They're connected by values. ASL is a full and complete language. It is not English in signed form. ASL has its own grammar, its own syntax. It's a beautiful and complete full language. When referring to this population, we are told that they like to identity-first nomenclature, so a deaf adult or a deaf child. The next 2 words on your screen, or on the screen behind me, deaf or hard of hearing, individual with hearing loss, hearing impaired. Hearing impaired is not preferred, but you will see it. These are words that refer to a medical diagnosis that hearing is affected. So throughout my presentation today, you're going to hear me using person-first nomenclature, like a child who is deaf or hard of hearing, to refer to these kiddos. Okay, so now that I've defined the key parts of this question, can a child who is deaf or hard of hearing have a deep reading brain? The answer is an unequivocal, is that the right way to say that? Is a massive yes. Yes, they can. They absolutely can. They can be deep readers, they can create their own future, and they can make a difference in the lives of others. It is beautiful. It is also very hard. So this will all circle back, I promise. Okay. Can I take this? Yes, I can. All right, Okay, on the left-hand side, I wish I had a really, really long pointer. I'm going to tell you real quick how hearing works. All right, so a sound wave comes into the ear. The ear is designed like a funnel. So it brings those sound waves right into the ear. If the sound wave is big, that means there's more intensity, it's the louder the sound. If the sound wave is close together, that means it's a super high frequency. Anyway, that sound wave goes into the ear canal, into the ear, through the ear canal, and it vibrates that tympanic membrane, also known as the eardrum. And that tympanic membrane moves with the vibrations of that sound wave. As the tympanic membrane moves, it vibrates those three teeny, teeny, tiny middle ear bones, the malleus, incus, and stapes, and they too vibrate with that sound wave. And then at the end of the stapes, it is connected to that snail shell organ called a cochlea. That cochlea is filled with fluid, and on the inside portion of that snail shell, there are teeny tiny little hair cells. Those hair cells are connected to the auditory nerve. So when a sound comes through the eardrum, then the malleus, then the incus, and the stapes moves in and out of it's called an oval window between the stapes and the cochlea. It vibrates the fluid that's inside that cochlea, which moves the hair cells that are wound around that cochlea and sends that signal to the brain. We hear with our brains. We don't really hear with our ears. The ears are just a doorway to get information to the brain. So that cochlea there, that snail shell organ, it's like the size of the tip of your pinky finger. Super, super tiny little organ. All right, so when we are told, put this back, when we are told that one of our students has hearing loss, right? That's really sometimes all the information we get. They have a hearing loss. Well, that doesn't give us a whole lot of information. A hearing loss can be mild, it can be moderate, it can be severe, it can be profound, it can be unilateral, meaning it's on just on one side. It can be bilateral, that it's on both sides. It can be conductive, meaning there's an issue in the outer ear or the middle ear, all the way up to that oval window. It can be sensorineural, which means there's an issue in the cochlea or the brain or the auditory nerve. It can be congenital, meaning it was there when the child was born. It can be acquired, meaning it comes about later in life. It can be progressive, meaning it gets worse over time. And it can be postlingual. An individual can be postlingually deafened, meaning their hearing loss came about after they have learned a language. All of this is important to know, what type of hearing loss. But what I really want you to hear today is that 0 hearing losses, no hearing loss is minimal. Every single one of those hearing losses is educationally significant. Children who are deaf or hard of hearing can also have an additional learning difference. 30 to 40% of children with hearing loss also have another learning difference. You may hear the term deaf plus. This is not widely accepted term. I'm teaching you all the not accepted terms as well, but it is one you may hear. A child who is deaf or hard of hearing, they see a doctor of audiology. So an audiologist is someone who does a series of hearing tests to determine the level of hearing that a child has. One of the tests that they do, the outcome of that test is an audiogram, which is up here on the right. The audiogram maps out the quietest sound an individual can hear at different frequencies, at different pitches, and at different intensities, different volumes. That it tells the sound or the amount of, it tells what a child can hear at each of those frequencies and intensities. They can detect the sound 50% of time, and then each ear is assessed separately. Okay, this is that same audiogram from the last screen. And on the right, and then on the left, there is a key kind of like kind of tells us what an audiogram is. So across the x-axis on the top of the audiogram is the frequency of sound. So think of it like a keyboard on a piano. So the lower frequencies are on the, I'm trying to think of this backwards because I'm looking at y'all like you do. But the lower frequencies are on the left and the higher frequencies are on the right. And then the y-axis, that is the intensity of sound. Quieter sounds are at the top, louder sounds are at the bottom. And then you'll notice an area called the speech region. That's commonly referred to in our field as the speech banana, because it looks a little bit like a banana. So this banana, this area of the audiogram, this is where speech sounds live. This is where, these are the sounds children have got to hear in order to be able to learn to read. And so if you're looking at the audiogram on the right, the red means right ear. The blue is left ear. And if you look at, you map that audiogram onto the speech region, we know that everything below that line on the audiogram the child has access to. Everything above that line, the child does not have access to. This is in conversational speech. So if you look at it, does this child have access to ooh? If you find ooh on the speech banana, you find ooh on the speech banana, it is at 50 and 500, right, ish. 50 and 500 on this audiogram. Does the child have access to that sound? They do, because it's below that line. How about shh? Shh is at 50 and 4,000. 50 and 4,000. Probably not. So what's this child going to hear if we say shoo? Ooh, that's all. They're going to hear ooh. Now, an audiogram is a measure of the child's hearing without hearing technology. So we know that hearing technology, well, we don't know, but the goal of hearing technology is to raise that line on the audiogram so that every sound of speech in that speech banana is accessible to that child. That is the goal of hearing technology. So why am I spending so much time on this? We're here to talk about literacy. Well, a very key component to literacy is to be able to map sounds onto symbols. And without access to all sounds of speech over time, you'll hear me use the phrase cumulative auditory experiences for all of the auditory experiences that a child has. How are sounds going to be mapped onto letters, and then letters be blended together, and then blended together to make words, and then how is a child to understand what they are reading? So I mentioned that the goal of hearing technology is to make all sounds accessible to a child. These are some of the forms of hearing technology that you'll see in your classrooms. On the left, this is a little guy with a hearing aid, a behind the ear hearing aid. In the middle, this little girl is wearing a bone conduction hearing aid. Those two types of hearing technology are for children or individuals who have a mild or a moderate hearing loss. They just make sounds louder. But they only make the sounds louder that the child needs to hear. So every hearing aid is programmed specifically for a child. So if we were trying to fit a hearing aid on the child whose audiogram we just looked at, we would just make the higher frequencies louder. We wouldn't make the lower frequencies louder because they didn't need that. So, okay, those are the two kiddos on the left. On the right is a little guy with a cochlear implant. He actually has bilateral cochlear implants. And the cochlear implant is for children who have a severe or a profound hearing loss, where if we made the sound louder through a hearing aid, it would just sound like mush. And so cochlear implants bypass the parts of the ear that are not functioning the way that yours and mine do, and stimulates that auditory nerve and sends that signal directly to the brain. So for children who are on a path to literacy through listening and spoken language, the hearing technology that they wear is the doorway to their brain. Because again, we hear with our brain. But hearing technology is not like putting on a pair of glasses, right? You put on a pair of glasses and everything is crystal clear. You put on a pair of hearing aids or a set of cochlear implants, this child is still going to struggle in noisy situations, life, and listening from a distance. Every time you double the distance from, there's the inverse square law is what this is called in my field. Every time you double the distance from a child, you lose 6 dB of intensity. So about 10 dB of intensity is described as half the volume. So if you think about it, if you have a child sitting at the back of the classroom, that's not very loud. Your voice is not very loud anymore. So just something to think about, and we'll talk about ways to help these kiddos in a minute in your classrooms. But an important message I want you to hear about hearing technology is that it's important that children have it. It's important that it's working, because there's nothing worse than a hearing aid in a child's ear that's battery's not working, because it just kind of acts like an earplug, which just makes hearing loss worse, right? It's important that children get hearing technology early, and it's important that it's worn every single waking hour, 10 plus hours a day. Our eyes, they were designed with eyelids, right? But our ears weren't designed that way. They weren't designed with earlids. They were designed to be open all the time. So we really need to be thinking about how do we support our families to make sure that their hearing technology, their child's hearing technology, is utilized all the time. On a federal level, the CDC, our CDC, has implemented EDI organizations in every single state. EDI stands for Early Hearing Detection and Intervention. And EDI's aim is to do 3 things. They want to make sure that every child is screened for hearing loss by 1 month of age. In the year 2000, this really kicked off in the US. So y'all's children, personal children, your students, they likely received a hearing screening before they left the hospital. EDI wants to make sure that by 3 months of age, those children who did not pass their newborn hearing screening have a follow-up diagnosis. If they do not pass that diagnosis, if they're diagnosed with a hearing loss, EDI's third benchmark is that they are enrolled in an early intervention program by 6 months of age. How are we doing? Okay, on this graph, on this chart, the 1 through 6 are down the y-axis, and across the top, I picked Georgia because that's where I'm from. I picked Tennessee because that's where we are, and I picked Vermont because they're doing pretty darn good in their state. Beside births across that row, in Georgia, we have 127,050 births each year. This data is from 2022 because funding. So this is the last data that I could find. So of those 127,050 children, 94% of them were screened before 1 month of age. Awesome. Of those 94%, only 19.6% of the children who did not pass their newborn hearing screening had a follow-up diagnostic by 3 months of age. That's bad. And then of the 19.6% of those that did not pass that diagnosis, that received a hearing loss diagnosis, only 47.8 of them made it to early intervention. In Tennessee, you can see the numbers there. In Vermont, they're doing much better. They have far fewer births, but they're doing a little bit better than we are. We have a lot of work to do, a lot. And there is work going on that I'm familiar with in Georgia to help fix these numbers, make this better. So these numbers aren't inconsequential numbers, and by numbers I mean the 1, 3, 6. Research shows us that if these benchmarks are met or exceeded, that a child has a much greater opportunity to have age-appropriate language and to have age-appropriate reading. Not included in this chart is the prevalence of children with hearing loss. So between birth and 3, approximately 3 of every 1,000 children have hearing loss. Approximately 5 of every 1,000 school-aged children have hearing loss. Yeah, 3 of every 1,000 have hearing loss 0 to 3. 5 of every 1,000 have hearing loss school age. However, if you took a snapshot at any time, any point in time, 1 in 10 of your children in your classrooms has some sort of temporary hearing loss from allergies, from ear infections, and these children do not have access to all sounds of speech. And it's important because like I said earlier, no hearing loss, none, not one, is minimal. I really thought that Scarborough's rope would kind of be like a drinking game here at the conference, but I think this is the only time we've seen it since your talk the other morning, Jane. So 136 is important because if a child can't hear language, or if they can't see it, if they're a user of ASL, they will not become a deep reader. Jan had 2 slides up that very first morning, yesterday morning when we were together. One of them said, reading is a highly complex task that involves many highly specialized linguistic skills. The other slide said that one must have language to learn to read. It's just necessary. And we can see that right on Scarborough's rope. All right, here's the deal. And I'm going to jump on my soapbox for just a moment. A child who is hearing, who has access to all sounds of speech, they learn to discriminate them, to identify them, to comprehend them. These children have lots and lots of time to develop these skills. They start listening in the 3rd trimester of pregnancy. They can hear their mom's voice, the voices of those around them during that time. A child who's deaf or hard of hearing does not have access to all sounds of speech of their mother's voices or those around them or around her. So a child with hearing loss is born 3 months behind already, behind their hearing peers. They do not have full access to knowledge and to language. And they don't begin building those cumulative auditory experiences that their hearing peers do until the doorway of their brain is opened with hearing technology. Hearing aids can be fit as early as a couple weeks of age. Cochlear implants for children who have severe or profound losses, the FDA does not approve them until a child is 6 months old. And these are best case scenarios. This only happens, like the hearing technology is received this early, if the family is told about the urgency and the neurodevelopmental emergency of that child not having access to all sounds of speech by the professionals around them. They needed somebody to come up to to them and say, just push the button on the shower, right? They needed somebody to just tell them. It's right there. The answer is right there. But they needed somebody to give them that information. Parents just don't know. Because oftentimes, a child who is born with hearing loss to a pair of parents, that is the very first child who has hearing loss that set of parents has ever met. They've never met. They don't know. Kind of like the first time you're a parent, you just don't know what to do with this child that you're gifted with. So once hearing technology is obtained, then it needs to be worn. So it needs to be worn. Those doorways need to be open, and then the child needs access to language nutrition. As the body needs food to grow, well, the brain needs loving words to grow. And what I mean by language nutrition is a child needs to hear 20,000 words or more per day, and even more important, they need to be engaged in back and forth conversation 40 times an hour. That's a lot. It doesn't have to be back and forth words. It can be gestures from the child. It can be a goo from the child. It can be a gaze from the child, but 40 times an hour. This is hard, but it's possible. On the other hand, ASL, I mentioned a bit ago, is a full and complete language. Its own grammar, its own syntax, its own norms. It's a language. And if it's literacy that is our goal, which it is, it doesn't matter what language. It can be spoken English. It can be ASL. It can be Portuguese. It can be Mandarin. It doesn't matter. At the same time, 90% of children who are born with hearing loss are born to hearing parents. Hearing parents who if they learn ASL, which awesome if they do, but have you guys tried to learn a language as an adult? I mean, all the Duolingo in the world, and I'm not a Spanish-speaking individual, despite how hard I've tried. But the time it takes to learn that language, that is taking time away from the child's cumulative language experience. Is it possible? Yes, but it's hard. So whether you go ASL, whether you go listening and spoken language, it's hard. Parents just have to pick their hard. So to sum up the last couple of slides, child needs to be screened by 1 month of age. They need to be diagnosed by 3 months of age. They need to be enrolled in early intervention by 6 months of age. The doorway of their brain needs to be opened 10 plus hours a day, and language nutrition needs to be on overload. If these things don't happen, like if those timelines aren't met, is the child doomed? Nope. No, they are not. But Harvard studies have shown us that during these early years, that 1 million connections are made in the brain every second. 1 million. And so if we miss that time frame, it doesn't mean that age-appropriate language is not possible. It just means that it's not going to be hard. It's going to be harder. And if the family does meet these milestones, the 1, 3, 6 milestones, are we done? Can children just join our classrooms and no more work? Well, that answer is no as well. There's still things that we absolutely can do to help these children access all sounds of speech all day long. We can read, right? Because reading, as you know, exposes children to words and phrases that they don't hear in everyday language. Reading creates more, helps us get to that 40 back and forth conversations, back and forth turns, per hour. Helps children be exposed to experiences that they may not have had. Use lots of language nutrition. Use big words, because children have big ideas. They need big words to be able to express those ideas. Don't shy away from them. Encourage enrollment in early intervention. And if a child is older than 3 and they're part of Part B, encourage an IEP. Encourage a 504. I'm going to talk about something called remote microphone technology in just a minute. Encourage speech and language therapy. Explicitly teach language constructs that are missing. So that little, the little guy whose audiogram I shared earlier, it's not a real person, a real child, it's just between you and me. That was just something I found on the internet. But that child can't access, without his hearing technology, and probably in a noisy situation, cannot access S. That's a super important one in our language. This child needs to be reminded that S goes on after anything that we're talking about that has more than one, right? That plural S. Also possessives. So get closer to this child. Let them hear that S at the end of the words, and then encourage them to use it. That's a rule that they can learn without having to hear that sound. And then we need to check our hearing technology of our children daily. If you work with little children, you need to check that hearing technology even more often. Make sure that the battery's working. Again, that the hearing aid's not just an earplug in the child's ear. All right, other ways we can help. So I mentioned earlier that both distance and noise are tricky for children who are deaf or hard of hearing. And not just for children who are deaf or hard of hearing, but for adults who are deaf or hard of hearing. For distance, get closer to the child. Seat that child closer to you. Do not raise your voice. Sometimes that's what I see happening with children with hearing loss. If the child doesn't hear what the parent says, the parent just says it louder. But that's actually detrimental because in our language, the vowels hold the most intensity. However, the consonants provide the real meaning. And so if we raise the volume of our voice, we are just making those vowels even louder, and they're going to overpower the consonants. So instead, we'll use something like remote microphone technology. And I would highly recommend that all of your children with hearing loss have a device like this. So remote microphone technology, something that looks about the size of this clicker here. It's worn on a lanyard around the teacher's neck. The teacher's voice goes straight to the microphone and right into the hearing technology of the child with hearing loss. It's as if the teacher's sitting right on the shoulder of that child, making sure that he can hear or she can hear every sound of speech. Also, classrooms can be outfitted with pass-around microphones. So there are a couple of microphones just like this one, that when it's a child's turn to talk, that classmate can go pick up the microphone and use that microphone to share their thoughts. And that signal also goes right to the child's hearing technology. And then in noise, again, get closer. Get closer to the child that you're talking with. Turn toward the child. 30 to 40% of English speech sounds can be read on our lips. That's not a lot. It's not all of them. Like anyone who says I can lip read, I don't know how much of the message you're getting. But it is helpful, right? It gives some cues. Turn off the noise sources that you can control. Get rid of that noise. Turn off the background music, right? If your kids like to, I know sometimes it's fun to have music on in our classrooms, but if there's conversation going on with the children, it can be detrimental for any child with hearing loss. Seat the child away from a window. Like if you have a window that is beside the playground, or I know when I taught one time I had a window, and right outside the window, twice a day the garbage truck would come. And the kids loved it, but there was no language going on during that time because that was such a noisy part of the day. If there's a loud street outside your window, seat the child closer to the other side of the room. Close your classroom door. It's an easy one. There's so much hallway noise. Leave that noise in the hallway and close your door. Put a carpet in your room. Put curtains on your windows. Put those tennis balls on your chairs, just to help keep the noise down in the classroom. And again, a plug for remote microphone technology here too. That remote microphone technology will help with that signal to noise ratio to make sure that the signal of the teacher's voice is always louder than the classroom noise. Oh, and please This is a reading conference, so this goes for not just children who are deaf or hard of hearing, but caption your videos. Even for your little bitty tiny kids, caption them all. How am I doing on time? Okay. All right, so here is Scarborough's rope again. You can pick up your drink, take a little sip. So background knowledge. I'm going to go through these pretty quick. Just some things that you can work on if any of your children who are deaf or hard of hearing are struggling in any of these areas. To help with background knowledge, use expansion. Use conceptual categorization. Make overheard conversations available to the child. If you don't have a pass-around mic in your classroom and a child answers the teacher's question, repeat what the child said. For vocabulary, classifying, sandwiching, building up, and breaking down, using visuals will all be helpful. For language structures, teach grammar terms. Teach them what a noun is. Teach them what a verb is. Use scrambled sentences. Give them lots of words and have them put those sentences in order. Whoops. For verbal reasoning, give them a child a picture. Ask them what they think happened. Can they infer from what they are seeing in the picture? Use think-alouds. For literacy knowledge, environmental print. Use teach parts of the book. Use think-alouds. And then for word recognition, for phonological awareness, pre-teach vocabulary. Teach what a syllable is. Teach what the end means. Teach what a rhyme is. Teach what the beginning, what you mean when you say, what's the beginning sound of this word? Introduce sounds that are dissimilar from one another first. So if your sounds are p and b, those are pretty similar, right? One's voiced, one's unvoiced. Teach b and v, or teach b and k, something that sounds different. Help them get the concept before you make the listening sound or the listening task harder. For decoding, present phonemes visually. We're all doing that now, right? Allow for speech reading. And then for sight recognition, use word families. Teach spelling patterns like DGE makes the sound j. Why? I don't know, but it does. So teach it. And then teach morphology. All right, this is my last slide. And I went through and I tried to look for pictures of some of my former students, And I couldn't find a ton, but I found some. And I just want to give some, this is all great and well, but where do these children end up? If we really do all of these things, can they really have deep reading brains? So I'm not gonna go through each one of these children, but on the left, the little guy with glasses, that's Will. Will has profound hearing loss. He wears bilateral cochlear implants. He's enrolled at George Washington University. He writes for both the business and the sports newsletter and for their foreign affairs newsletter. He loves to travel. He loves to learn new languages, and he loves to read. Amanu, he is in the middle. He's kind of looking up like this. Amanu is also profoundly deaf. He wears bilateral cochlear implants, and he is in his first year of law school at Emory University. Below Amanu, with the dog, that's Diego. And Diego was here in the States for his younger years. His family moved to Spain. They still live in Spain, but Diego came back to go to NYU, and he is in his second year at NYU. Caroline, in the red dress, she too is looking up. That kind of must be the pose of choice. Caroline, I love because she too is a graduate of the University of Georgia. When I taught Caroline, she had these little teeny tiny pink hearing aids. She had a progressive hearing loss, now wears bilateral cochlear implants. Caroline graduated as valedictorian from her high school. She went to college at UGA, graduated from there, and she's headed to Harvard Law School in the fall. So is it hard? Yes. These parents and educators picked their hard, and realize that these children were worth it, and they are. These children can and do. They are deep readers who chose their own future, and they are making a difference in the lives of others. Thanks.
Okay. Ooh, sorry. Thank you. That was wonderful. We are going to have our break, our second, the afternoon. This is still the morning one. Our second attendance code is, we're going to have it displayed in just a minute during the break. It is all means all. That's all caps, no space. ALLMEANS ALL 36. All means all 36. So it'll be displayed through the break. I'm going to go ahead and close the day 1 attendance verification form and open up the day 2. You're going to receive an email. Maybe you won't receive an email. If you don't receive an email, open up the Google form, okay? So either way, pick your poison. All means all, so it's this, all means all, but it's all caps and all smushed together, and then 36. Okay, that's your attendance code for session 2, day 2. Okay? And you know where to find me if you need help or you didn't get your email. So we're going to resume at, I believe, 3 o'clock. Can somebody check the schedule for me? I didn't bring it up with me. I believe it's 3 o'clock that we're resuming. 2:30, 2 o'clock. What? 2 o'clock. See you at 2 o'clock.
was gonna move it, but we gotta wait. 'Cause I don't want it to. Or maybe they would one over there. Cause they may. It's gonna keep it. I don't want. I want to exit. I don't know. But it's just with this on it. Yeah. So I think we can do those two, then one, and then the other one. We're gonna wait. But I don't want to touch it while they're still. So I'm waiting. Okay.
Yeah, sure. Yeah, that's my power cord, so.
No, it's okay. I got it. Yeah, I got it. Thank you. I'm sorry. Are you okay? Yeah, it's fine. Okay.
Don't worry, it's only $600.
I just dropped that.
We did it.
I muted it so it was.
I'm glad you did that.
Yeah, I know. I was like,
Yeah.
It should be fine, right?
Should be. We had someone intentionally mic drop. Just gonna check it real quick. Can you? It's just in.
applies to all of them. So your point isn't dyslexia. Your argument applies to all of them. You want to sit in the middle or do you want to sit on the
Well, and I am,
Perfect.
she and I work together
Perfect.
on this small role and implementation of this book together. So questions for Vicki, I
That's good to know. Good to know. It's 30 minutes. You're doing fantastic. Well, are we on? Are we on? We on? We on? Are we on? Hi, everybody. Welcome back to an intimate Q&A. For those of you joining us online, thank you for being with us. Now, when you fill out that Google form, it's not going to automatically send you an email. Don't panic. Don't email. It's cool. So be cool like Fonzie. Because in a week or two, you're going to get a form that says that you attended. And here's your CEUs for whoever you want to go get those with. But remember, who do you want to be like? We want to be cool like Fonzie. Don't email Karen. Thank you for... So I have the pleasure of having people to help guide this moderated conversation here with two of our speakers. And channeling Vicky will be Jan. So what are our questions? Let's start off. Do we want to start off with the online questions first, since they kind of got a little under sunlit yesterday? Do we have an online question? When we get a mic. So we'll get a mic back there, and that'll be good. And they're going to get you a mic back there, or do I want to bring you mine? She's on it. All right, up front, who's got a question? Around the room, who's got a question for our audience, for our panelists? Okay. 50 came fast. Here we go. None about sounds, right? Okay. I remember you. Who do I give you the mic to? Okay. Not about sounds. Okay.
But there is a sound debate. Just saying. I was curious. I've listened to the Sold a Story podcast and was very interested in the Steubenville schools in Ohio. What do you think about their process for interventions and grouping between grade levels?
I too, like everybody else in the United States of America apparently, listen to Sold a Story podcast. Big fan of Emily Hanford and her work. I was very interested to listen. I listened to it twice, actually, the episode about Steubenville. A concern, this is not part of your question, but I'll just say, since I have the mic right now, part of the reason I listened to it twice is because I'm a little concerned that that is one of the episodes of this wonderful, wonderful podcast that could be interpreted as saying, if you want successful kids, you need to do Success for All. If you want your kids to read, do exactly what Steubenville did. Adopt that curriculum. That's the magic bullet. I think I hear Emily saying that's not true, but it should not be interpreted that way. Success for All is a wonderful model. It has lots of evidence for success, but there are other ways, too, to help a whole district or a school. However, one of the things about the Steubenville model is that they allow students to receive instruction across grade levels. And I'm really eager to have that opportunity to talk about that. I was going to mention it, I probably will again mention it in my very quick closing keynote tonight. It says an hour. We're not going to spend an hour on that. You don't have to leave to get out of that. But the idea of children moving to other classrooms at other grades. Cross-classroom is one thing, which is also can be just a really good idea. But across grades can have tremendous benefit for children, and it can have tremendous benefit for teachers, because we can get the right students in front of the right teachers and making sure that the load is appropriate. We can arrange children so that those high needs children get the more intensive, smaller groups that they need, instead of every teacher having their 25 or 30 children. That just doesn't make a whole lot of sense. There's evidence to show that cross-classroom and cross-grade grouping can work. I experienced that myself. I had to reflect back on it, like, why did I walk down the hallway for reading? It was such a neutral thing. It was simply told to me, you go down to that classroom down in the other hallway for reading. So I did, and thinking back about that, I was in 3rd grade. I was going to the 6th grade classroom for reading. And to me, it was just neutral. It was just, you go to that classroom for reading. But the other thing we need to think about is it was presented as a totally neutral thing to me. I don't remember feeling different in that classroom. So who is the child being asked to move? Can they handle it emotionally? Who is the receiving group? Are they going to be okay with this third grader in their mix? And who is the teacher? All those individual, like Vicki was talking about today, you need relationships, you need trust. So we have to make those individual decisions. But as a construct, a concept, it makes a whole lot of sense. You know what does not make sense is grade levels. Grade levels, like this idea that third grade, you're this age, so you go in third grade. Those are just made up ideas. And you look in any third grade classroom, somebody might say, oh, that's all these kids are about the same age. No, they're not. There's usually about a 2-year range of physical chronological age in a classroom, maybe more. And different levels of maturity. We know some of those little girls, we know this just to be a fact, that some of those little girls, and especially if they're higher skilled, they may have an emotional maturity to walk down to the hallway and work with kids in 2 or 3 grades above. So I'm a big fan. I think the research supports that. I've experienced it, no scars here. So I say yes.
Well, going back, are we ready for online? Grace under pressure.
Thank you, Tim. Thanks for your patience. Okay, this question is about multilingual learners. This person wants to know if you have any suggestions for resources regarding dyslexia in multilingual students. I often find it is harder to get early intervention for students who are exposed to 2 languages.
Okay. Multilingual learners should receive instruction in classrooms where I would strongly advise all teachers who have that joy and challenge of working with multilingual learners to be familiar with and use the SIOP structure, the Echevarria et al.'s structure for providing instruction in classrooms. So you SIOP, S-I-O-P, structured, sheltered, I never remember what it is, instruction, the I is instruction, but S-I-O-P, SIOP, to begin with. Then for dyslexia, I would run, not walk, to the materials that have been created by Elsa Cardenas-Hagen. She's written extensively on this topic. She is maybe the world's expert, certainly among the world's expert in dyslexia and multilingual learners. She does a lot of writing and work with multilingual learners who are not dyslexic, but she knows both of those areas so well. She's written on that articles and books. That would be my go-to. She is my go-to and her work is my go-to. But that combination too, the SIOP structure for a classroom which supports language development for multilingual learners, has a many decades evidence base behind it. Children in a SIOP structure who are struggling with dyslexia or other challenges are going to be supported by that structure. And then for specifics, Elsa Cardenas-Hagen will have some suggestions. Do you want to add anything to that? Do you have some thoughts on multilingual, bilingual, multilingual and dyslexia?
It was specifically on instruction. I think you covered what we would do. I would point those who are IDA members, so International Dyslexia Association, or who are aware of the often publicly available resource called Perspectives on Language and Literacy. Last year and a half, Elsa and others of us got together and wrote a special issue in honor of the anniversary of IDA, and Elsa covered this topic as part of that. And I believe that she's written in other kind of open access teacher-facing outlet. So I would point you to an International Dyslexia Association resource on that topic. From our own center here at MTSU, we have an expert minute on our YouTube channel where Dr. Elsa Cardenas-Hagen, who was a speaker at the last Fox Reading Conference, talks on this topic in a 5 to 8 minute informational kind of context. So that's all I would add, is just plug some resources where you can get access to translational research to practice materials.
Hello. And I have one more plug. There are some great resources for dual language learners on Cox campus, which is created by the Rollins Center at the Atlanta Speech School. Check that out.
Thank you. Yes.
Great resource from the Cox Center down there in Atlanta, Georgia. So here in the room now, is there another question from amongst us in person live, folks, before we go back online? We got some. Good. Okay.
Right there, in the back. Karen's got her.
So this question is regarding spelling and children with dyslexia. Should we be grading spelling? What do we do about BD reversals? Is there any guidance on that you can provide?
We've been talking about spelling. That is not the area where I I do not know the newest research. You got to draw the line somewhere. I'm fascinated by the intersection between spelling, encoding, and reading. Many years ago, I did some research on the CBM spelling assessment, which I rarely see anymore, but it does exist. Like the original CBM ORF, it's just a protocol. It's not a program, but it is an assessment, and it's really a scoring system that I really appreciated, because the idea of in CBM curriculum-based measurement scoring for spelling, you score correct letter sequences. So instead of looking at a word that like love, that a child might spell L-U-V, and you say, no, that's wrong, in a CBM, it would be space to L would be a correct sequence, L to U would be an incorrect sequence, U to V would be an incorrect sequence, but you get 1 point for that. And in my experience, giving students and the teacher the approximation instead of just 0, that is not a 0. I mean, if a child wrote love and wrote QRX for love, that's a 0 too. That's very different than LUV. And I've often wondered about giving, and maybe subsequent research, I again stopped sort of following that research, but I always wondered about somehow giving half credit for a phonologically correct sequence. So full credit for correct grapheme sequence, half credit for grapheme and somebody may have done that. I just stopped looking at that research, so I don't know. Okay, Tim, you have, yes, okay, good.
So
Come up here, Kathy.
Oh, no, I've done enough time on the stage so far. For spelling, you really want to make sure that you're integrating your spelling with your reading instruction. That's where you're going to get the biggest bang for your buck, because the phonics skills relied on for spelling are the same ones we rely on for reading, so they're reciprocal skills. And for spelling, especially in our younger grades, getting that, what Jan was talking about, the phoneme-grapheme relationship is really important. And so praising students for doing that and helping them expand as they learn more phoneme-grapheme correspondences, how can they determine the right one? But children will often lag further behind in spelling than they do on their reading. And if you think about it with spelling, it's because in reading, I can look at that and come up with the sound or start going through the sounds. But if I have to spell, you've got caught, and that has an O-U-G-H, which is aw, but that could also be why isn't an A-W. They have to know the exact correct one. So spelling will often take longer for students who struggle than reading will, so you can expect them to fall a little bit further behind, but continuing that instruction and also helping students reference, what does it look like? Does that look like the correct word that you know? If you were to read that, how would you sound it out?
Okay, so I have a question. What if they're don't struggle. So we are sitting in a position where we have multiple students that are, their ORF scores are very high, comprehension's high, vocabulary is very high, and then all of a sudden they're in the second percentile for spelling. And
But
that's kind of where we're struggling now, because we see these very high achieving kids on paper, but then spelling comes and that's really their downfall.
So that's because, I'll talk, this is, so this is where the research is really helpful. Also with people who have looked, that have just been educators. We were talking about Royal Aylett Cox, the work of Louisa Moats, and really thinking about the structure. What makes English so challenging, so if you read Becky Treeman's research, is that we have an asymmetry between spelling and reading, and Catherine really highlighted that really, really well. And so English is tricky for reading, but it's even worse for spelling. And so of all the writing systems in the world, is one of the trickiest, if not the trickiest, for spelling. So that means you could read, and there could be more consistency, even though it's not 100% consistent, than for the spelling piece of it. So that means if there's going to be theoretically more challenge, as Catherine was saying, it will be in the spelling, and it makes the formations of exact orthographic or letter patterns critical, to where you can use. One of the things that Catherine studies is something called set for variability, which is we use and we put into a word strategy called vowel alert. If I alert to the vowel, I know that a vowel says certain types of phonemes, and I can try those different phonemes. If it's in my lexicon of pronounced words, I can land on it and say, oh, that's the word. It's a lot more difficult to do that for the spelling piece. And in fact, there was research done out of Florida State University that tried set for variability as a spelling intervention, and it didn't work. It actually worked less well than a cover copy transcribe approach, which was shocking to the researchers. But it makes sense if you think about where Treeman and others, Louisa Moats' original research published in Annals of Dyslexia, have always pointed to, which is there's this asymmetry there. So it's really, really critical. And when you get to your advanced students, and if you do take a direct instruction or you teach morphology, it's really important to remember that morphemes have 3 components. They have meaning, pronunciation, and spelling. Of those 3, the only consistent one is meaning. You can have a shift in the pronunciation, so it can be d or t for vowel suffix ed. Shun can be spelled different ways but have the same meaning. So the meaning is the only consistent thing about a morpheme. So as we adopt and we come into thinking about more explicit morphological instruction in those upper grades, so when that kid grows up to be a 3rd, 4th, or 5th grader, if you do morphological instruction, remember there's 3 representations, and therefore an entire chunk, and it's sometimes an entire syllable, such as our final stable syllables like shun.
I'll also jump in. This is a conversation Tim and I were having at lunch, is what does their nonsense word fluency look like? And which assessment are you using for nonsense word fluency? Because some nonsense word fluency CBMs are only giving CVC words. And we know that when you have to spell, whereas there are some that will go all the way through vowel teams and multisyllabic words as nonsense words. And that tends to give you a better picture on their decoding ability of all phonics skills. If you have a nonsense word fluency in which you're just doing CVC words, you're really just assessing, do they know the alphabet? You're not getting into variable vowel patterns, you're not getting into multisyllabic words, you're not getting into any of the chunking. And so we've seen kids that will go through and not get flagged on the nonsense word fluency, but will continue to struggle. And the ORF, they're able to do it because of that context and that background knowledge. And so they're missing some of those chunks. And it will come out in spelling instruction because that is harder. So being able to find some other assessments, and there are nonsense word fluency assessments out there that do go into those advanced phonics skills.
Jan, did you want to add more?
I would just think when you give those numbers of the so many students doing so well and yet so many struggling with spelling, that to me is an instructional opportunity. We just look at how you're spending your time on certain things and carve out. We don't have enough time, we don't have enough money, don't have enough people, but that's an instructional issue. Kids can be taught, and we often just don't teach spelling. If we do, it's the old method of here's 15, 20 words, memorize them, regurgitate them on Friday. That is not effective, but there are effective spelling curricula that do systematic design of spelling patterns and morphological teams and those kind of things. Teach that through explicit systematic instruction, and kids will learn to spell. If you teach them, they will learn.
And the pitch for spelling comes from 3 independent meta-analyses. The first one was by Steve Graham and others. Most recent was by Chandler et al. When they looked at what kind of spelling instruction will do is, when you get at that grapheme phonemic correspondence, that'll actually make your reading better. But overall, we found, historically from Steve's first meta up, that spelling instruction, the motivation for why Steve wanted us to focus on spelling for so much was because it improves reading. And of course, Steve did the famous writing to comprehend meta in 2011. And so why do we want to teach writing? Because when we teach writing, we get better comprehension. And of course, we want them to pass those state's reading tests. That's the only thing that we care about. So you better teach them how to comprehend. Otherwise, we're in trouble.
I want to bring this back to the ladder, too. If you look at Nancy's ladder, the green area says spelling and writing. Even those kids who are the precocious readers will likely benefit from instruction in spelling and writing. Karen has her hand up over here. Another question?
Yeah, do we need to go online? We need to go online, and then we'll go to Karen.
Online first? Okay.
Yes, please.
Thank you. Okay, we heard a lot about the importance of language. Should language be included in benchmark screening? And how should it be addressed in intervention for our students who are below benchmark?
Join us. No, come.
Okay, I'll go.
You're here. You have to help us.
I would say yes, we should have language be part of benchmark assessments for students. It's how you're going to catch those that are struggling with language at an earlier age, where you can do a lot of those interventions that will impact reading comprehension. Most systems don't have great language screeners right now that are able to be used kind of across the board in the same way that phonics does and decoding benchmarks do. And so it's, I think, an area that we're still researching and an area that still needs a lot of growth.
We have a chapter in the book from Tiffany Hogan and colleague about developmental language disorder. And in that chapter, you're going to find lots of resources for assessments of language. And we probably are not, as we get more sophisticated about this, because the answer is surely yes, we need to be looking at language, not just, yeah, you should look at language. We need to be more systematically. But it's probably not going to be a universal screener where all the kids are doing it. We can do a lot through observation to judge our students' language, and then do more of a diagnostic assessment rather than taking the time to screen all of our students. That's my just hunch right now. Maybe we will get some short, quick language assessments that would be valuable to use as a screener.
And to refer back to what Erica said in her presentation, those 40 conversations back and forth between children at a young age is hugely impactful on their language ability and their future comprehension. And the paper that you had in your presentation, and I'm going to forget, but it's by Lena. I'm going to forget the name of it, but it talks about how you will see increases in their achievement testing in 3rd and 4th grade based on the number of back and forth conversations that students have at those very young ages.
Right. There's research that shows that vocabulary that a 3-year-old is directly correlated with vocabulary at kindergarten, 3rd grade reading scores, high school graduation, incarceration. And all of the screeners I know for language will not catch a whole lot of kids. They're pretty basic.
I will say that there are an emerging set of screeners which are quick and effective. There's also a meta-analysis that was just published by Ward et al. Showing that sentence repetition has high diagnostic accuracy for identifying kids with DLD. It takes 5 minutes to do. It taps into so much, and it's more than just a working memory task. Importantly, it taps into syntactic structure and how you chunk things into meaningful units. So that would be kind of a promising line. And I actually, since I do kind of help to consult with industry a little bit, I can say that there's things on the horizon. There are the few things right now that are on the market. But Fox is here for you, for free, and not for me to pitch a program or a screener right now. Back there now.
Hi, I have a question for Erica. I I have a question about the technology for hearing impaired. Sorry, deaf and hard of hearing. I'm still working with a family to help them understand their child's needs in the classroom. I do have access to sound towers. He currently does not have an FM system. So my question is, would a sound tower benefit him, or would it be more beneficial to have an FM system that actually correlates with the microphone that the teacher's wearing?
So that's a great question. The remote microphone technology that I am most familiar with is Phonac's Roger technology. And that technology has both a sound field tower for all of the children in the classroom and a component that goes straight from the teacher to the child's hearing technology. If there is not personal remote microphone technology available, then the tower would be absolutely second best. And in the school that I was last in, at the Atlanta Speech School, every single classroom in that school, whether it had children who are deaf or hard of hearing in it or not, had Roger technology, because improving the signal to noise ratio is good for every child, not just children who are deaf or hard of hearing. So it would benefit all of the children to help this kiddo out by using a sound tower, for sure.
We're going to take one more question from online, and then we're going to transition to our closing keynote. So last question from online.
Okay. This person would love to know your thoughts on whether aligning Tier 1, Tier 2, and Tier 3 is important.
Yes.
Well, Carolyn had a caveat to that in the car yesterday. This came up in a conversation in the drive. Remember, Carolyn's point was a good one. If your Tier 1 sucks, they won't help. So differentiating a crummy Tier 1 won't help you out too much. So I think that's what we can think about too. Carolyn Denton is here in spirit
really
right now.
important. Yeah, let's not align and integrate to a crappy Tier 1. Let's have a high quality Tier 1. And then there will be, when we go really down the tiers, there are going to be children in Tier 3 who are going to need something different. So it's not just take core instruction and keep adapting it and aligning it differently and increasing the dosage. It may be that there are some children who need and deserve something quite different.
I would second everything that Jan said. And for those of you that teach older students in middle school and high school, there is also current research ongoing, but also research that shows that aligning your Tier 2 and Tier 3 in those grades to be able to use content area texts that are talking about the same topics they're talking about in those content areas can also be very beneficial. And you can teach those same reading comprehension strategies, vocabulary strategies using content area text. And then you're building even more background knowledge. Those students are getting a double dose of that content area knowledge that they probably struggled with in that Tier 1 setting. So aligning, whether it is in a gen ed classroom and you're doing Tier 2 or with your older students, aligning with what their current content area is teaching as well is incredibly beneficial.
Well, I want to thank our panelists and you, so let's give them a round of applause as we transition into Dr. Hasbrook's closing keynote. So don't go anywhere, stay put, okay? This is going to happen fast. We did a dry run through this earlier. It went smooth and flawless, and we're going to do it again. Perfect.
All right, I'm going to watch my time. I said I'd bring this in under an hour. I'm going to do it, okay? Hold me to that. Thank you all for being here for this conference. Thank you all for being the people who stay to the very end. No shade on the people who had to leave. I don't ever judge anybody because I've often been that person. We have to leave for very different reasons, but it's just wonderful. I'm very grateful that you are all here. Nancy is watching. She's participating. Nancy Young, who is the lead co-editor of this wonderful book that this whole conference is about, Climbing the Ladder of Reading and Writing. So I know she's watching right now. She really, really wanted to be here, and today she sent me a text that I want to read to you. From Nancy Young. Thank you to all the organizers for inviting me to present at this wonderful conference. I truly wish I could have been in Tennessee with you today to speak alongside colleagues who so generously contributed their expertise to the book that Jan and I co-edited. Unfortunately, circumstances did not permit my traveling to the United States. I'm so grateful for Jan's willingness to delve into the messages of my ladder of reading and writing during her keynote, not only making clear that there is a wide range of ease in learning to read and write, but relaying to you my passion for supporting educators and families in better understanding who needs what and why. Enjoy the sessions. I hope you did enjoy the sessions over the last 2 days. Keep questioning and be prepared to evolve in your thinking. Great words from Nancy. Thank you, Nancy. Thank you. All right, climbing the ladder. I can't condense this too much. Climbing the ladder of reading and writing all means all. For no reason at all, I am showing you again my picture of my children. But let's get to the topic. So listening to these presentations, wonderful, diverse topics, but all around a cohesive message for the last 2 days. Reading and writing are complex processes, and learning to read and write is a challenge for many learners. All students deserve to acquire the life-changing skills of literacy. And we know that they can. They deserve it, and they can. Children with ADHD, children who are deaf or hard of hearing, children who are older and still struggling with reading, children who have a specific comprehension disorder. All means all, and we can do that, and it's up to us to make that happen. We started with this way back when. You've seen quite a bit of me at this conference because of Nancy's absence. But yeah, learning to read and write is a very complex process. We have had lots of people try to give us graphics and mnemonics and different ways of making it a little bit more understandable. But in the end of the day, learning to read and write is a big deal. And it's really important we get it right. Many of the presenters have used actual children or individual or experiences, examples of children with these challenges. I want to introduce you to one more as we close this out, a young man named Noah. And I don't know Noah. I never met him. The only way I know Noah is a piece of writing that I'm about to share with you. Noah was, at the time of this writing, a senior in high school, 18 years old. His mother identified that he was dyslexic, reading at about the 4th grade level, spelling maybe on his good days around the 3rd grade level. Every day in his English language arts class, we have this information from his mother. Every day in his English language arts high school class, he needed to write. He was required to write in a journal. His mother tore out a page from his journal and handed it to a colleague of mine, Dr. Nancy Mather, who was speaking at a dyslexia conference. And this mother handed Nancy this piece of paper, just heartfelt and I'm not sure what their conversation was. I wasn't there. But Nancy then shared this page of writing from Noah. I included this in my book, Conquering Dyslexia, and I show it frequently because I think Noah did one of the best jobs I've ever seen of articulately stating why he deserves help and fairly well, you can see, you can judge for himself. I think it's a very articulate piece of writing. It is very articulate, but it's very hard to read in terms of handwriting and spelling. Handwriting's actually not that bad, but his spelling is. So allow me to read it to you. You can read along with this Noah's statement to his teacher, but to all of us. Today, I was so embarrassed in English that I never want to go to English class again. When you said you were going to pass out the paper back out, I knew it was going to be bad. I can't figure it out, but the loudest kid in the class always gets my paper. She makes fun of my spelling and calls my name out in front of the whole class. Then she keeps pointing out my misspelled words, and all the kids around her laugh and look at me. This is not the first time I have been embarrassed in class. I hate popcorn reading, and I just sit there and freak out, and I can't listen to the story, and then a kid calls on me, and I have to say pass or just turn red in my face. I hate English. And I hate thinking about it. These journals don't help me, and I hate doing them. I'm not going to be a writer as my job, so there's no point in it. Spelling and reading are my disabilities, and I get no help to get any better in it. The school doesn't help me, and that's why I hate school and all the kids who laugh at me. School just hurts me. I don't know what your reaction is right now. I have goosebumps, and I have read this maybe 200 times. It gets to me every single time. This should not happen to children. And he's right to be furious and angry. We cannot create situations where for any child, school is a hurtful situation. We can do so much better. So despite this complexity, the more we study reading, the more we know how complex it is. Despite that complexity of learning to read, we can help students achieve success. In my book, Conquering Dyslexia, I wrote about, I made a statement, this is in the book, that compelling evidence from a convergence of reading research clearly indicates that approximately 95% of all students can be taught to read at or approaching grade level proficiency. Since I wrote that, and for many years, my thinking around that statement has been evolving. First of all, just thinking about, I mean, it's legitimate that it keeps evolving. It was wonderful that Nancy's statement said, keep thinking, you know, keep learning and keep thinking. Because this science of reading, this, as the Reading League defined it, a vast interdisciplinary body of scientifically based research about reading and issues related to reading and writing. I really like this definition. But if I had been asked to contribute, I would have suggested these additional words. The science of reading is a vast, unfinished, and continuously growing and evolving body of evidence. So we need to keep thinking and evolving. If I made that statement about 95% and then continued to watch as others were weighing in on this, people I really admired and respected. In 2020, Louisa Moats wrote, researchers now estimate that 95% of all children can be taught to read by the end of first grade, with future achievement constrained only by students' reasoning and listening comprehension abilities. Sharon Vaughn and Jack Fletcher wrote in 2021, we think there's ample evidence to suggest that educational systems can be organized so that the vast majority of students, close to 95%, can be reasonably successful readers, when there are organized systems are effectively implemented. So those are all little nuances on this idea of 95%. Margaret Goldberg partnered with Claude Goldenberg to make a statement in 2022. There is now general understanding with the right instruction, approximately 95% or more of all first and second grade students could learn to read at a level primarily limited by their oral language abilities. So those nuances I wanted to include in my thinking and my statement. So part of your handout, should you care to download it, is a 6-page document that I have created. I started it in the late 90s as I wanted to what is our goal? You know, it's not 100%, but what is our goal? What should schools be able to achieve? And since the late 90s, I started documenting every time I saw a study or a well-informed opinion paper about the percentages. I wrote it down. And then the overall summary statement I made about it continued to evolve over time. So you have that 6-page document if you care to. It's in the handouts that I sent if you care to look at that. But I'll go through the gist of that right now. So my wording has changed a little bit based on the thinking of my colleagues. Compelling evidence from a convergence of reading research clearly indicates that approximately 95% of all students can be taught, that's the operative word there, taught to read at or approaching grade level proficiency in grades 1 and 2. Things really get different and complicated as we move up, but in those early years we can launch. Claude and Margaret say 95% or more. And most students will continue to improve their reading outcomes. The actual percentage of reading success is limited primarily by students' oral language abilities. These statistics include students with dyslexia and other learning disabilities. The appropriate systems and structures must be in place. I'm very happy that I added that statement, because when we just say 95% of kids can read, then it seems to all fall on the shoulders of teachers, and we don't want to do this. Teachers play a huge role, but it's not just teachers. It is indeed the systems and structures, as Sharon and Jack talked about, and we need collaboration in order to do that. We need time to work together. If you remember my wedge this morning with that arrow underneath it, we need more brains at the table the more complex we're dealing with. My statement continues, students are most successful when they receive early instruction. It's just a fact, but we also know that it's never too late. This instruction should be provided by teachers who are well informed and well supported. Those are very important defining characteristics. The most powerful instruction is comprehensive, systematically designed, explicit. We're going to talk more about that aspect and integrated together. We know that learning to read is a process that our students have to go through the same learning sequence no matter where they are, who they are. We also know there's a range of ease for our students, as we've talked about at this conference. Therefore, differentiation is needed. In every classroom, we're going to have those students who already know it, who will learn it with typical instruction, and those who need and deserve a little bit more. Carol Connor, I don't know that anybody has referenced Carol Connor yet at this conference, but I didn't want the conference to close without us honoring this amazing researcher who contributed so much to our understanding about differentiated instruction. She's cited everywhere in our book, as you will see. She wrote that the best way to teach young children how to read has been debated for more than a century, but we have research that shows now there is no one best way. That's one of the reasons I want to say, what the miracle of Steubenville is not just because of a miracle curriculum. Curriculum makes a huge difference, but there's not just the one perfect one. There is no one best way to teach reading. The effect of various types of instruction depends on the constellation of skills that each learner brings to the classroom. So we know our students are not one size fits all. Students, many of our students deserve that extended learning or acceleration. It's essential for them. Learning to read, as it says in the continuum, learning to read is effortless for some of these children, but instruction, good instruction in spelling and writing is still needed. And doing some of that extended learning and acceleration should happen in cross-grade classrooms. Some students we need to be paying attention to, picking up the pace, moving them through the curriculum more quickly, many more opportunities for that implicit learning that happens to all of us all the time, but we really need to be paying attention to it for some of our students. And then we have our students who need and deserve what Nancy wrote in her infographic, a comprehensive analytical approach to learning language structure is likely essential. So what is meant by that comprehensive analytical approach to learning language structure? Well, we could break it down to these components. It means that instruction is comprehensive, systematic, explicitly delivered, intensive, and multimodal, and always informed by data. In the broader literacy world, those components these days are often being referred to with the umbrella term of structured literacy. For a variety of reasons, Nancy did not want to use that term structured literacy on her infographic because of, and she explains it very well. She's quite articulate about her reasons for wanting to avoid that term. A lot of, I could summarize it in that once we adopt a term, kind of like structured literacy, something like science of reading or other terms in our field, they start to morph in terms of what their meaning really is, and they get misinterpreted, and people think they're talking about the same thing, and they're not. So instead, Nancy wanted to use the term comprehensive analytical approach, as you will see on her infographic, and described in the chapter on instruction, chapter 3, that she co-wrote with Margie Gillis. But all of these, that comprehensive analytical approach addresses the what that needs to be taught as well as the how reading should be taught. The what, we can look at all those Scarborough's rope and Marianne Wolf's possum, and knowing that whenever we think about what needs to be taught, it does need to be differentiated. So what needs to be taught? It has to be all the stuff. It has to be comprehensive, and then the design of the instruction systematic. Comprehensive meaning all the components, word recognition and language, and bring it up to fluent execution as addressed in those graphics. Comprehensive means we make sure that students acquire those foundational skills plus the advanced skills. Surely it's not phonics only, and we have to then continuously be building knowledge and language. Writing and spelling must be included and integrated, and that is instruction in writing, instruction in spelling, and weave that into your instruction in reading. It all has to be integrated, quality supports for tiers across the tiers, and as needed, specially designed instruction for our students in Tier 3. Our students who receive Tier 3 services. Systematic design, essential to effective instruction, addressed in the infographic in the purple arrow. Systematic design, we, in the chapter where we were defining this, we relied heavily on the work of Doug Carnine and colleagues who said, systematic design means you have carefully selected goals, you have a defined scope and sequence, defined scope, and then the sequence, a huge part of effective systematic design is that sequence of skills that you've identified, moving from easy to hard. Erica talked about separating those possible confusions for children, move from the foundational to the applied skills, lots and lots of clear examples, Some kids need just a few, some kids need a whole lot, and some kids need a tremendous amount of examples. Frequent reviews, interleaving, distributed practice opportunities, and then a system for corrections. That's really, again, basically systematic design in a nutshell, and it's based on Carnine and colleagues' work. So what needs to be taught needs to be comprehensive and systematically designed. How do we teach it? Explicitly, intensively, and using multimodal. Explicit, several of the presenters have talked about this, the 50 years of research that have led us to understand explicit instruction, show the students, provide sufficient guided practice, and give them ultimately some time for independent practice. Often, thanks to Anita Archer, as articulated as I do, we do, you do. Vicki talked about this, and some of the other presenters alluded to it a little bit, that there's actually another step in here that can really benefit a lot of children, and it comes between steps 2 and 3. I do, we do, y'all do, and then you do. That's that collaborative practice that she talked about a lot. So the teacher is working with the I do and the we do, perhaps at the teaching table, like Vicki talked about. Collaborative practice, y'all do. Kids go together, young students, middle school students, high school students, and collaboratively work on projects and products. But ultimately, all the children need to demonstrate to us that they have learned or mastered or are on their way to mastering the skill. Small collaborative groups, Vicki talked about this, I'm going to use the word should, be used across the grade levels. These are some pictures of schools that Vicki helped implement that structure of small group collaborative practice along to support whole class instruction, whole group instruction, and these include middle school students and high school students. Explicit instruction, part of explicit instruction is that term guided practice, and that sometimes in this world, since we are just leaving the period of time where balanced literacy was the way that colleges and universities were training teachers to teach, it gets conflated, guided reading and guided practice. Guided reading means a lot of different things to different people. It's definitely one of those terms that is not really carefully defined and used the same way by everybody. But in general, guided reading implies to many, many reading teachers that you assess students to find their appropriate level, and you teach them in that level. They read, and then you check on them to make sure they're making progress. Guided practice is very different. Guided practice is an essential part of explicit instruction. It is that we do step. Instruction provided by a teacher, a tutor, even two students working with each other, but a key aspect of the guidance is correction. That's what differentiates instruction from practice on your own, where there's nobody there to give you that correction. Instruction or guided practice step in instruction includes corrective feedback and supportive feedback. Sometimes we use the word feedback and it always sounds like correction or redirection, but sometimes that feedback is supportive feedback. Differentiated dosage for guided practice. Some kids need, I do, we do, you do, you're ready to go. Really the dosage issue is often that fine balance between the I do, we do, I do, we do, we do, we do, I do, we do, we do, as Catherine shared with us. And we need to scaffold that challenge reading. That's part of guided reading as well. Not just teach to find your just right level and keep you at your just right level. Vicki talked today about Tim Shanahan's new book. I'm glad she read it. I have read it. It's a fabulous book. Leveled Reading, Leveled Lives is Shanahan's book. It's really quite an easy read, but it talks about why we went wrong with this kind of leveled reading. There never was any research, and why it can be damaging challenging to students. So we do want to scaffold reading. We want to get those stretch texts in front of our students, but not just here, take a challenging text and go read it. Tim's book really talks about how to determine how to choose one, and how to teach it, how to do the instruction in challenge level reading, not instructional level beyond the early stages. So quoting Tim, the notion that kids should be taught to read with relatively easy text, instructional level text, is great for beginners, actually. It does make sense. But by grade 2, or once a student is at that level of established reader, this approach is likely to hold students back. So we got to do all this stuff, the I do, the we do, the collaborative practice, the independent practice in a range with a range of abilities. How do we do that? Well, you heard from Vicki Gibson today. She, chapter 5, goes into more detail. She shared some of the big picture of that today, but chapter 5 will really give you the guidance for how to do that successfully. Intensive instruction, I think every single person up here on this stage presenting to you used that term one way or the other. We need to have a sense of urgency. Clearly, that did not happen to Noah in his career. He's an 18-year-old senior in high school and still writes and spells and struggles like that. Way back when he was 5 years old, it was probably very evident that he needed extra help. There was no sense of urgency. Urgency means we don't waste time. We don't let let weeks go by with kids struggling. That's another reason for that progress monitoring. Let's find our successes or our lack of success as early as possible. Keeping up that perky pace of instruction, narrowing the focus, using our information from our data, using the intensity of a small group differentiated instruction. We have to be relentless. It's really, really hard. And we don't have enough time, we don't have enough money, we don't have enough people. We still have to It is a moral imperative. We have to do this work. And it has to be thorough. We can't just touch on these things. We have to bring kids to mastery, as it says on Scarborough's rope, increasing automaticity, increasing strategic implementation. The intensity also means lots of active engagement in classrooms. We want students talking. We want teachers to do as little talking as possible. With very young children, teachers are going to be doing a lot of talking, but that should fade away. And the students are reading orally as much as possible. And the most time, as quickly as we can get them into sentences and connected text, that's where the payoff is. They need to have a pencil or pen in their hand. They need to be encoding. They need to be spelling. They need to be writing. They need to be talking and discussing and sharing and commenting, and frequent responses. If you are, as I am, a devotee of Anita Archer, she pulls on that massive amount of research of frequent interactions, frequent responses, high proportion of interactions and responses from students. I addressed briefly multimodal instruction yesterday as moving away from that term multisensory, which implied some things that have subsequently been found not to be supportive or particularly valuable in instruction. But we do need all sensory modalities, as Vicki did her little triangle, the hear it, see it, say it, as well as the writing and spelling, and keep that all connected to what we're actually teaching. That's that integration again. If this is a language concept you want to teach the words related to it, the morphemes, the words, the vocabulary, have the students learn to spell those words, have them use it in their conversation, have them write about it. And all of this, what needs to be taught and the components need to be informed by data. You all sat through that this morning, data-informed decisions. Highly effective schools use the framework of questions to guide their assessment. We should not do any assessments if they're not tied to an important question. We don't have time, money, or people to do that. Ask the important questions. If you want to use these questions, that would be a good idea because that's what highly effective schools do. Start with your question, then go get the assessment that answers that important question as quickly, efficiently as possible. Up front, we need to know who needs help and what help do they need. Ongoing is the progress monitoring, is the work working. So I want to share one more thing. This has not been mentioned at this conference, and I think it's a really wonderful framework for thinking about the complexities of instruction combined with and aligned with and driven by data. And I want to share, I'm anxious to share it with you. We can go through it very quickly, but I want to give credit to my colleague, Deb Glazer. This says it is Hasbrook and Glazer because we wrote about the AAA framework in a book that we wrote called Reading Fluency. That's where this is documented, is in that book, Reading Fluency. And in that book was authored by Hasbrook and Glazer. But this piece, AAA, came straight out of Deb Glazer's head. And it is aligned to the framework of the instructional hierarchy. If we want our students to learn, we have to start with, we use the framework of AAA, we always start with accuracy. First, foremost, and forever, on every skill that students acquire, it has to start with accuracy. Accuracy is the foundation for automaticity. Once they've reached a reasonable level of accuracy, or as they're moving toward that, we bring in automaticity, because we can't just leave it at accuracy. All skills need to move to automaticity. And in the area of reading, which is what we're talking about, the only reason we do any of these individual discrete skills is in the service of comprehension. It's all about comprehension when we're talking about reading. So the third bullet there should be comprehension, but comprehension doesn't start with an A. So in Deb's framework, she used the term access meaning. So let me use Scarborough's rope one more time, revisit how I shared with you the data collection at the various stages of development, but now I'm going to add the AAA instructional framework, because we don't collect data for the collection of data, we collect data to inform our instruction. So now I'm going to complete this thought. The emergent stage, we do that letter assessments, the optimal assessment, the quick, valid, reliable assessments that answer those key questions, letter naming fluency, letter sound fluency, and language assessments as needed. Then that drives the AAA instruction. Accuracy, automaticity, and access meaning of blending and segmenting, letter names, letter sounds, and always developing language. I used to say that AAA, we really can't get to that third step, the third bullet, the access meaning, until we get to words. And I have completely changed my mind about that because of something I witnessed. I was hanging out with my daughter, who at the time was working as a nanny. She worked as a nanny for multiple families for 20 years. And she worked with multiple families because she would always start a few weeks after birth, and then she would work with the family until the youngest child was ready for preschool. Because my daughter strongly, strongly believes that children need to be in a high-quality preschool. So she would help the family find the right preschool for their child, get them, and then she would move to a new family. So she was working with a family, just one child in this family, a little boy, who, on an aside, this is not relevant to the story I'm going to tell you, but this family was raising him as trilingual. He was, at the time I'm going to tell you the story, he was about almost 2. He was not quite 2, maybe 19 months old. But mother, from birth, had only spoken Mandarin to him. Father had spoken French to him. And they speak English to each other, and my daughter spoke English to him. So he was He had this brain filled with 3 different languages that he was learning. But they were going to go to a park one day in Seattle, and she called me up. I happened to be in town, and she said, "You want to come and hang out with us at the park?" I'm like, "You bet I do." So I went and watched them. And this little boy, barely walking, he was walking, but not very confidently, and wandering around. And he wasn't talking a lot. Children who are bilingual, trilingually raised often don't have the expressive language. That's a little delayed. It seems they're processing all these 3 languages in their heads. So he wasn't a little chatterbox, as children often are at that stage. But he was walking around, and what I saw him do is walk over to a sign on the lawn at the park. There was a sign. I don't remember what the sign said. It probably said, "Stay off the lawn," is what it said. But he walked over to that sign and pointed to a capital L on the sign and pointed to it and looked over at my daughter and said, "Lulu," which is the name of their dog. And my head just about exploded in that moment, because I thought, here's this little kid. His brain is learning and processing 3 different languages. He's got a superb nanny, obviously, who is teaching him the alphabet and developing his English language and connecting symbols with sounds and letters. It can start very early, connecting the symbols that we use. He uses a visual symbol, if he were using a different tactile symbol, that might come a little later. But AAA can start at the letter level, is my point. Novice readers, when they're in this stage, we collect the data with word reading fluency, nonsense word fluency, and the AAA instruction, accuracy, automaticity, access, meaning at words, decodable words and decodable text. Transitional, now they're reading text moving away from purely decodable. We can do the ORF. AAA instruction would be passage reading of instructional level text. For this brief period of time, this is where we do want text on an instructional level. We want to get out of that. That's why we call it the transitional stage. We don't stay here very long. But the instruction would be accuracy of all the words. Can you read them? Accuracy also means understanding, not just not say the word, but understand the word. Can you read all those words? Now let's read them with automaticity. Let's build in expression and prosody and talk about what that text means. Once our students are established or proficient, the AAA instruction should move ahead with passage reading of increasingly complex text. With support, this is instruction in complex text. For our students, as we've talked about, who are stuck at this level, they've moved along in reading, but they are not the established or proficient readers. Their AAA instruction should be targeted to the identified needs. It could be a heavy dosage of phonics and decoding. For many students, that will be moving toward multisyllable words, morphemes, decodable, from decodable to complex text based on their need. Ready to wrap up? Reading and writing are complex processes. Learning to read and write is a challenge for many learners. All students deserve to acquire the life-changing, perhaps life-saving skills of literacy. And it's up to us to make that happen. So, how about this? Let's all work. Let's all agree to continue this work that we do to help all students successfully climb the ladder and weave the rope of skillful reading and writing. I'm getting emotional. From the bottom of my heart, I thank you all for attending this conference. I thank you all more so for choosing to do this work that is incredibly important to the lives of children and families. You are changing the world with the work that you're doing. Thank you so much.
Well, I have a lot of thank yous to do. I want to start with her, because we saw each other in Atlanta. and I was blind, literally blind. And I had so much gratitude for you because we had this extremely large hole to fill because Nancy wasn't able to be here, and you stepped up. So thank you for going above and beyond for us. So let's give her a round of applause, everybody. I have a ton of gratitude for the director of the Center for Dyslexia. I want to get emotional here because Karen is remarkable. Because she comes in, she works, she does, and we're better together. I mean, I'm good at a lot of things, but organization is one of them. But organization of people process over long periods of time is not it. So thank you, Karen, for all that you've done. Please give her a round of applause. Kim Haig, who you saw at the reception desk, has been manning it. She runs the ship, so thank you, Kim. To Jen Stewart, Aaron Alexander, all of our students who were here to man it, everybody from multiple programs. We have school psych students here, we have PhD students, we have alumni here. It's been fabulous, fantastic. And I didn't have to do most anything of this except for just say, wouldn't it be a good idea to do this, Jen? Since you're an author of this great chapter with Stephanie. And they just took off and ran. So I just want to thank all of you for what you do and everybody making this work possible. So thank you for that. The attendance code, all means all, 36. That's what you use. If you fill out the Google form, you will not get an auto email. We're going to be cool like Fonzie and not email Karen. Say, where was the email? Did it come in? Just wait for a few weeks. If you don't get something then you can email and reach out to the center, and then we'll try to find out if something went wrong. Okie dokie? Karen's being real loud. Yeah. Cool like Fonzie, everybody. You'll get your certificates. Thank you, guys.